friends too.
Hello, 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 hello.
ऐसे करवाना, ये टाइट करवाना। चालू कर
इसको बंद ही रखते हैं, सर आएंगे उसके बाद ही ऑन करेंगे। ऑफ कर दो। ठीक है, तो आपके वहाँ से ही आएंगे, वहाँ से हाथ में पकड़ाओगे। ठीक है। एको ऑफ हो जाएगा ना, तो आजू बाजू का वॉइस बहुत कैप्चर होगा, फिर क्वालिटी नहीं आएगी वॉइस की। हाँ,
हेलो
फिर अगर
हेलो।
बंद हो जाए तो
हाँ,
मैसेज।
ऑफ ऑफ करके देंगे। ऑफ दबा करना।
Good morning, everyone. On this crisp and wintry morning, we extend a warm welcome to each one of you.
The past few days have been a thrilling journey of enlightenment and entertainment for all of us, exploring a diverse range of knowledge, dance, music, and beyond. As we near the culmination of ACIES 2023, we shift our focus to a crucial aspect that holds great significance for every student, the career talk.
I, Neha,
And I, Priyanka Bisht,
are delighted to be host for this session. Within this unique segment, you will be discovering the careers that harmonize with your skills and passions. Our team of experts in public health and hospital administration will offer you a first-hand look into their professional domain, shedding lights on both the intricacies of their work and the authentic challenges prevalent in the industry.
public health and hospital administration encompasses a variety of roles within the healthcare that focuses on improving the health of people at a community level. This opens doors of opportunities for students like us to build a career and become an asset to the community.
Our panel for today features distinguished speakers, each bringing a wealth of expertise to share in the field of public health and hospital administration. The insights promise to make our discussion both engaging and enriching. We also look forward to addressing the queries that have been sent in by our engaged audience. So let's embark the journey of knowledge and exploration.
First and foremost, we extend a warm welcome to Dr. Anish Sinha, sir. Sir, please join us on the dais.
Now, we cordially welcome our eminent guest speakers for today on the dais. We have with us today Dr. Saurabh Parmar, Team Lead Technical Support Unit for the World Bank Shrestha Gujarat Program at IEP Global. A very warm welcome to you, sir.
A second guest for today is Dr. Anup Nair, Deputy Director and OD Deputy Director, HR and OD, Piramal Foundation. A very warm welcome, sir. Please join us on the dais.
Okay. Next, we welcome Dr. Akash Shinde, Senior Program Officer, Family Planning, Japaigo.
Our next speaker for today is Dr. Sandeep Patel, Founder, CEO of Doct Hub, Ahmedabad. We welcome you, sir.
Our next speaker is Dr. Dilip Parmar, Assistant General Manager, Torrent Group, CSR. Thank you for joining us, sir. Please join us on the dais.
Now please welcome Dr. Purav Gandhi, Founder and CEO of Health Arc Insights. We welcome you, sir.
Next, we have with us Dr. Tulsi Mahadevia, Director of North Star Diagnostic Private Limited, Ahmedabad. Welcome, ma'am.
Up next, we have the last speaker for today's discussion, Ms. Meeta Patel, Founder of Medicines. We welcome you, ma'am. Now I would like to request our moderator for today, Dr. Anish Sinha, sir, for the opening remarks. Dr. Sinha is a registrar at the Indian Institute of Public Health, Gandhinagar. His specialized areas include immunization, vaccine preventable disease surveillance, health system strengthening, and occupational disease. We are honored to have you, sir.
Very good morning, and thanks to giving me the opportunity to give the opening remarks for this important event and the ACIES which we were going on for the last 2 days. Today it will be an end with one of the most important events, the career talk. So first let me extend our heartfelt gratitude to the esteemed panelists who have come here from different parts of the country and representing different sets of organizations, right from the core public health to CSR to consulting firms to hospital sector. So thank you all of the panelists here. for sparing your valuable time and interacting with us. Just to give a brief about what we are, so we have gathered here the students and the budding public health professionals from Masters of Public Health and Masters of Hospital Administration from different universities, not only IIPHG, from different universities, who are actually eager and looking forward to contribute to the complex and challenging health sector. So what we want from this discussion is, or the outcome, they get an insight of the real world of challenges and what are their opportunities for them and how we can collaborate further. So moving ahead, I request, as per the plan that they have, see each panelist will be given, say about 5 to 10 minutes to speak about their organizations, largely opportunities that they have. And then after each panelist that we will have questions from the audience. And I encourage all of you to ask the questions, the most difficult ones that you have. So that it can be answered here in a much better way. I am not the right person. They are the better person to answer all these things. So thank you. And also I would like to mention here, we have one of our alumni here, Dr. Akshi Bawil, probably in 2022 batch or 21 batch. She's also here from one of the recruiting agency who is representing this panel. She is currently working in Health Hub. You can definitely in the breaks interact with her also. So thank you.
Thank you so much, sir. Now we invite Dr. Saurabh Parmar, sir, to brief our audience. Dr. Parmar is presently working as a team lead, technical support unit for the World Bank-supported Shrestha Gujarat program at IPE Global. He's a public health expert with over 10 years of experience collaborating with the government and developmental partners to plan, design, and implement innovative public health programs and solutions. He has worked across a diverse range of geographies and thematic areas, including maternal, child, and adolescent health, immunization, clinical research, hospital planning and designing, HIV/AIDS, CPHC, pandemic preparedness, surveillance, and One Health. Over to you, sir.
Yeah, good morning, everyone. So, thank you IIPHG for inviting me and this opportunity. So before I begin, I'll share my own experiences and I walk you all through my own career journey. I did my post-graduation in the community medicine. So I had been, with the God's grace, been fortunate enough to for the jobs. So before I had my final examination while I was pursuing the post-graduation, myself and one of my friends, so we both applied at that time the NPSP, National Polio Surveillance Program, that was by the WHO, that was a big thing, and we both applied for that. And so interview went well, so that was around 4 or 5 months back, before our final examination, post-graduation examinations, and we got selected. So I got selected for the Uttar Pradesh and my friend for the Madhya Pradesh. So around 5 months before appearing for the examination, we both had our offer letter, and so in our mind it was that we now will have to pass out our exam, and then since we already had the offer letter, so just after passing the exam, we joined both. So I started my career with the NPSP WHO as a surveillance medical officer in Uttar Pradesh, and it was a very great experience, a rich experience. So that was my first job. So I had been in the Western UP. I had been there for 2 years, and then I thought of moving out of that space, and I tried to explore into the maternal child health program. So I applied for the Japaigo, and I got selected for that position, and then I moved to Rajasthan. It was a tribal district, Banswara. So I worked there for around 1 year, And then I applied for a position within Japaigo for, it was the national level position. So so that was one of my dream to work at the national level. Then I joined the India country office. I worked for around 1.5 years. Then I thought of coming back to Gujarat, and I worked with the UNICEF in HIV/AIDS and adolescent space. And then again, I got opportunity to work with Japaigo in because pandemic was there, and there was a USAID grant. So that was in which that was a project in which I looked into the 3 states, Goa, Gujarat, Maharashtra. I worked for that project, and finally now I am working with this IP Global for, this is the World Bank supported program. So this is how my career journey had been. But a few tips I would like to give you about your career, or before you start your career, just identify which are your key interest areas and focus on your strength, that which are your suitable skills. And whatever the company you are aspiring to apply for, that I would suggest before the interview, just do a very good research about the company itself, who is the donor, what would be your roles, responsibility, because the recruiter is asking a very specific question. They have a very specific problem, very specific domain area, for they would be hiring you as an expert. So just do your homework well about the organization, about the donor, about the project, what would be your role, responsibility. So that would be very much helpful. And during the interview also, because I guess one of the questions that you all might face is that since you are the fresher, why we should give you the opportunity, kind of. So these are the questions just to test. So this is not to hire you, but this is just to test your negotiation skills, right? So just before the interview, have a mock interview maybe with your friend. So it would be helpful, just list down what could be the expected questions that you could get. So in public health, what I believe is that it's a mix of soft, in any industry it is mixed of soft and hard skills. But in public health, I believe that around your soft skill, that is contribute around maybe 60-70%, and 40% you need to focus on your technical specific skills. So during interview also, you can walk through your interviewer that how specific area they are looking for, and with your experience, because people like to listen to the stories. So you will have to assure them, provide the assurance that how you would able, with your experience and your skills, how you were able to solve the specific problem. So you can narrate those stories, that what was the problem and what was the challenge, and how your skill and expertise helped in solving those problems. About the soft skill, I believe in public health, the critical thinking is the most important skill that you should be having, because critical thinking is exploring the multiple things, whatever the literature and the best practices available around you, and then you have to mix it to resolve the problem that is ahead you. So I guess critical thinking is the skill that every recruiter is looking for. And this is it. This is all from my side. And if any other question you have, just please, you are free to ask. Thank you. Thank you so much.
Thanks, Dr. Saurabh. So if there are any questions from the audience.
Sir, you mentioned that before starting a career, we should try to focus on, we should try to identify our key strengths and focus areas. How do we do that?
Meditation. Yeah, so that is the thing. So I think this is, you will have to sit along with yourself, and also what I suggest is that you have a group of close friends, right? That just discuss with your friend, just ask your close friend that what you believe that you feel that I must strength, right? And a key technical focus area you can identify by yourself, like I believe that I am good at Excel, I am good at analyzing or what are the skills that you feel that you are good at? Maybe you may be good in documentation. So your friend may tell that, yeah, you are good at documentation, but you'll have to see that, so that is, you are the best person to judge what are your strengths and what are your weaknesses. But identifying and working on the weaknesses is equally important, especially when you are aspiring for a job that requires a particular skill set. And I would suggest to, based on the job you are applying, I would suggest to build upon your strength. Go through because internet is full of very rich resource material and the guidelines and the research papers available. So just focus on identify the specific area where you like to build your strength, and just discuss with the expert, because that is so one of point. You may please sit down. So one is so that is not related to your question, but what I would suggest to do is that when you are applying for a particular job, just identify one of your alumni who has been working there, or you may reach out to the people on LinkedIn also. One of your senior also reach out to me on the LinkedIn, and from the 7th she is joining. So just one of my suggestion is, लोगों पता कैसे चलेगा कि आप हो, ठीक है, आपने अप्लाई किया है, या यहाँ पे कोई कंपनी है जिसके लिए आप अप्लाई करना चाहते हो, ठीक है, इस कंपनी में आप काम करना चाहोगे, ठीक है. तो आई सजेस्ट टू बी प्रोएक्टिव, जहाँ पे खास करके आपको कोई पर्टिकुलर ऑर्गेनाइजेशन में, कोई पर्टिकुलर जियोग्राफिक एरिया में, कोई पर्टिकुलर इंडस्ट्री में आपको काम करना है, जस्ट रीच आउट टू देम. राइट, थैंक यू.
So, thank you, Dr. Saurabh. One message from his journey that he shared briefly was, don't restrict to yourself geographically to your comfort zones. Be ready to go to the most challenging area, and wherever the opportunity calls, you should definitely grab that. If you want to do well and rise and contribute effectively to public health. So any other question? Even we will take up at the end if the time permits. So if we can take one more question if they're there, or we move ahead with the next speaker. Okay, so we can move ahead with the next speaker.
Saurabh, for your valuable insights. Now we invite Dr. Anup Nair to provide a comprehensive briefing for the audience. Dr. Anup Gopal Krishnan Nair has over 2 decades of experience, wherein he has successfully navigated diverse geographical and industrial landscapes. Holding an MBA in Human Resource Management and a PhD in the field, he has been an entrepreneur in global human resource consulting space, in addition to being a seasoned business manager. For the last 6 years, he has been associated with the social sector, strategizing HR support in one of the largest not-for-profit projects in the world. Handing over the mic to you, sir.
Morning. While they fix the presentation that I have, जो मैं रट्टा मार के आया था, I have a humble request to make to Dr. Anish and Tapasvi sir here. It's been almost 3-4 years that I'm coming to this campus in various capacities, and every time it happens कि मेरे पहले आगे वाले speakers मैं जो रट्टा मार के prepare करके आया वो बोल के चले गए. अब मेरे पास बोलने के लिए कुछ है नहीं. So it's a humble request, Tapasvi sir, Anish sir, या तो मुझे पहले बोलने दीजिए या फिर मेरे को कुछ प्रिपेयर करके दीजिए कि भाई तू बोल के जा, so that I don't end up embarrassing myself. So thank you, Dr. Saurabh, for stealing my thunder. And on that note, morning all of you. So as I just said, I've been coming to this campus for almost 3-4 years now in various capacities, and I'm a human resource professional. Yeah, so again, I'm a little lost for words क्योंकि मेरे को जो बोलना था already बोल चुके हैं. So that's that. However, I have a very clear observation to make. Every time I come to this campus, every time I come and recruit from this campus, which I have actually consistently been doing for the last 4-5 years now, yeah, and you have a lot of your alums working with organizations that I have supported, or maybe they have supported me and they have come, touched me in particular ways and moved on to other organizations, yeah, they're still contributing. Excellent alumni networks that you have. Every time I come here and I look at these bright faces and I address them, adds to the value that the entire ecosystem craves. You know, I think, जैसे मैं बार-बार बोल रहा हूँ, 4 या 5 बार मैं आके जा चुका हूँ, I think this would be the 5th or 6th time. There is a marked difference in the kind of people, in the kind of subject matter experts with whom I have had the privilege of sharing this dais with. In an esteemed institution like this, when we started off, I think 2018, when I started off in 2018, I had the good fortune of sharing this dais with some subject matter experts, but basically from the social sector. What we call typically NGOs, and some very big NGOs at that. Over a period of time, we have had some very esteemed panelists who are coming here who are not necessarily from your social sector enterprises. This is especially for people who are doing their program in public health. That in itself is proof that this sector itself is growing. Look at the panel that's sitting in front of you. Some of these organizations are doing amazing path-breaking work, causing a lot of disruptive innovation in a market space which was uncharted, unprecedented, even a last couple of years back. Yeah? As I said, for somebody like me who is an accidental social health professional or a social sector professional, it is a gratifying experience to be part of this journey. So, career talk to aapka ho gaya. So, there is career. And there are avenues which are as yet uncharted in which you can actually grow. On a very lighter note, every time I come to the campus and go back, the students would call me and say, Anup sir, aap har baar dara ke jate ho. Dara ke kyun jate ho? Because you come and say that if you want to be in the public health and if you want to be in the sector, you'll have to work in rural areas, go to Bihar, go to Jharkhand, go to Uttar Pradesh, yeah, and from, say, Ahmedabad, Delhi, Bangalore and Mumbai to Begusarai, Balia, Giridih, it's a big change. But I have seen the change happen in front of my eyes that is not necessarily the case. On that note, let me introduce the organization that I am representing now. I'm part of the Piramal Foundation, and Piramal Foundation, of course, is part of the larger Piramal Group, which is among the largest corporate houses in the country. Now, the foundation per se is focused on improving the lives of vulnerable communities, and we do this by strengthening government systems and leveraging the power of youth. The spirit of service, or Seva Bhav, is the cornerstone of our success thus far. And when I mean success, it is very well articulated in this PPT. We are an organization which is currently 5,000 people strong. We have our operations across 27 states and 2 union territories in this country. And we are proud to say that we have directly or indirectly touched the lives of at least 113 million Indians over the last 15 years. We claim domain expertise in public health, education, water, and gender. We run programs, multifocal programs, across all these verticals. So we are committed to something that we term as building Bharat. And when we say building Bharat, you'll ask, how do you intend to do this particular grandiose agenda of yours? So this is what we have identified, and this is what we claim to be doing. The work we do is focused on two focals. One is strengthening the institutions, and the second is strengthening the communities that we serve. How do we do that? So we are committed towards interventions across 4 broad frameworks. One, digitization, because we strongly believe that access to correct, consistent data is the cornerstone of success or for any intervention. Leadership is paramount to what we do, and when we say leadership, we focus it down to working with middle managers. We have a lot of interventions which is working with the middle managers in the ecosystem, government agents, on their leadership capabilities, and we do this by focusing on their self-transformation, which we have observed over empirical studies leads to system transformation for the better. We are committed towards decentralization, and when we say decentralization, the building blocks of our democracy is the Panchayati Raj system, and we work very closely with the Panchayati Raj members. We engage with the block and district bodies, and we support them in whatever changes or knowledge transfer is required. And of course, inclusion is part of the journey. We are very committed to ensure that the 10 to 15% of the communities which are never touched, or which are never quite given the benefits that we enjoy, are also included in all our interventions. Now, I said we have 4 focus areas, right? We're all taking notes. अच्छा बता दो 4 focus areas क्या है? I'll leave the PPT behind, notes mat lo. Be happy with that, yeah? I like undivided attention. I'm a bit of a stage grabber, so I'll leave the PPT behind. So having talked about the 4 key areas that we work in, we don't rest with that, right? We also have identified 6 domains that we are convinced will change the systems. So the 6 domains within these larger 4 focus areas are education, health, leadership, sustainability, inclusion, and of course working on the women and youth. So 4 grand focus areas, 6 domains. And that's not the end of it all. So your 6 domains would have further subdomains that we work on. So for all of you professionals, public health and medical background, so let's take health for that. For that. So if you look at health as a broad domain, we have subdomains within health on which we work at. Nutrition, women and child health, we work on communication and non-communicable diseases, vector-borne diseases, A, B, C, D, E, we work on reproductive health, and all of these will have specific programs, we'll have specific subject matter experts, we'll have specific people dedicated to adding value to these endeavors. So to cut a long story short, 6 domain areas, at least 10 sub-function within each 6 domain areas. So that's like at least 60 subdomains that we are working in, pan-India, 27 states and 2 union territories. Okay? फिर अब आप बोलोगे कि बॉस ठीक है, you're working too much, but what is your measure of success? Yeah, I mean, you're investing money, you're investing resources. How do you ensure that there is return on investment? So we are very focused on measuring impact as well, and we measure the impact that all of our work has based on this particular framework you can see on the screen. Pretty self-explanatory per se. So we are very focused on measuring impact for every single stakeholder at every single stage, and we have a team dedicated to collecting, analyzing, presenting, and documenting data which measures the impact on predefined parameters at every stakeholder level. The stakeholders may be the community, the frontline workers who support the community, the entire panchayats which support the frontline workers that support the community. We also work very closely with hyperlocal NGOs and social sector organizations who know the pulse of the area that they cover. Of course, we work with the district and the state level officials, and we can't do anything without partner organizations and donors. So we measure the impact, document the impact, gather all the data and present at every single stage. So when I say stakeholders and donors and supporters, just an indicative slide to sort of elucidate the kind of people that we work with, the kind of organizations that we partner with, and the kind of knowledge transfer that happens between the foundation and a lot of these organizations. So, ये सब हो गया, इतना PPT मैंने रट्टा मारा था. एक चीज़ रह गया अभी. I mean, when we start a PPT, a normal organization will start with vision, mission and such. So technically मैंने उससे चालू नहीं किया so that थोड़ा समा बांध सकूं. Yeah. So, but now the question is, what is the vision? So the vision, as articulated clearly by the organization, by the foundation, and by the promoter, is very clear. We are committed towards building Bharat through digital leadership, leadership development, decentralization and inclusion, all this led by women and youth. And as an HR professional, I am very committed that every single of these bombastic statements that I have made and all the words and bade akshar that I have presented, we build interventions around every single one of them. We work on strategic business units. We like to term this as our big bets that we are focused on, and the big bets are as follows. So, for every single focus area that we are committed to work on, we have a specific strategic business unit, what we like to term internally as our big bets, and we are committed to support these big bets to the logical conclusion. And my favorite slide, thank you.
Thank you, sir, for your insightful and very encouraging words, both for the students and the IIPHG. Let me just, I'll take a few seconds to say, to retreat our association with Dr. Anup. Dr. Tapaswi is also here, so the association goes long back. I'll not go into any further details, but in different capacities, he has been helping us wholeheartedly in the best possible way. He has supported our students for internship, dissertations, placements, and many more things. I would retreat to say that he has even gone beyond the line of duty to help our students complete their dissertations in most challenging and I would say the laboratory of public health in Bihar's remotest areas. And so we are very indebted to you, sir. Thank you for coming all the way from Patna to Gandhinagar. So now we open for the questions if you have.
Hello, sir. For the last few months, I've been reading about the Gandhi Fellowship, which I got to know in my last college. So for, like, as a
So for a 21-year-old like me, what do you suggest would be better, applying for the fellowship or applying for to work in professional capacity at your foundation?
May I get your name, please?
Shruti.
It's not my foundation. Yeah. And B, it is typically a question that is best answered by yourself. Yeah. What do you want with life? What is it that you want to be doing? Where do you want your larger purpose to guide you? Yeah, so that's a question I can answer you. So the Gandhi Fellowship is a very unique concept. You're not going to be making exponential money out of it. But you'll gain a lot as a person, you'll gain a lot as an individual, and it'll give you an alternate perspective to life.
But sir, it'll take 2 years of my time. So
Again, everything has a toss-up. There are no free lunches. Yeah, you'll have to invest. If you don't invest, I mean, you have a lot of entrepreneurs here. Maybe they can let you know. If you do not invest, you'll not get any returns. Yeah, so it's a toss-up. 2 साल में आप और क्या कर सकती हैं, और 2 साल में आपको गांधी फेलोशिप करना है. I would encourage. I mean, if I were you and if I had the opportunities, I would have done the Gandhi Fellowship. Yeah, not that holds true for you. Did I answer your question or did I confuse you more?
no, I think I'll look into it. I wasn't sure, but now I think I'll look into it.
Sure. Okay.
Any other question?
Hello, good morning, sir. Sir, I am a first year MPH student. I have background in BDS. So I'm really confused. I cannot figure my interest. Like first semester is almost over. So we have read the basics. So like how to figure out where to work in public health?
I have no idea how to answer that question actually. How old did you say you were? Sorry? Yeah, so at the age of 24, I was selling SIM cards for a living in Ahmedabad. Yeah, but having said that, I think the key to this particular decision-making process is what Dr. Saurabh said. Read up and engage with a lot of people. See, until I came into this sphere, I didn't even know we had career opportunities here. I'm a human resource professional, 15, 16 years, worked across 15, 16 multiple geographies, countries, set up an organization of my own, sold it off. Then I came to the social sector. मेरे को तो पता ही नहीं था कि career options भी होते हैं social sector में. I had no idea. For the life of me, I could not have imagined that this is a vast ocean. और मुझे तो सच बोलूं ये भी नहीं पता था कि Masters in Public Health करके कोई डिग्री भी होती है. So figure it out. And you figure it out by talking to a lot of people, reading up. Yeah, you have your esteemed professors and all who are stalwarts in this particular sector. Talk to them. Be recipient. And also connect with a lot of your alums. आपके alumni network बहुत ज़्यादा strong है. चाहिए तो number मेरे से ही ले लो. I should be in touch with 150 or 200 of them all. Talk to them because they have been in the sector for I think at least 2-3 years. And of course, there's a lot of people here on this dais who are working on some very innovative blue ocean strategies which would use skills that you bring to the table. That's a totally different genre of work that has been coming up. ठीक है?
Thank you.
Tapasvi sir is there. Tapasvi sir needs the mic.
I think, sorry, and thank you for coming, but on behalf of students, I would like to ask that whether it is Piramal Foundation is looking for Bihar or for all 27 states you said working?
All of them, sir. So we have moved. So थोड़ा मेरा भी promotion हुआ है, sir. Only from public health, थोड़ा आगे बढ़े हैं, working across all the verticals. So I'm not just responsible for the health and nutrition vertical now.
Thank you, sir. So it's an opportunity for us to engage more and see what learning you should. How many of you are connected with your alumni, and to what numbers? He is not an alumni of our institute. He is connected to more than 150. Together, I am sure if you add up everybody's connections with the alumni, may reach 150 together all. So it's important message to connect with the alumni where they are working. So that will help you understand the vast ocean which is the public health and the health sector. Okay, so if there are other questions, we will take up in the end. So let's move ahead. Thank you, sir.
Thank you, sir, for your valuable insights. Next, we invite Dr. Akash Shinde. Dr. Shinde is a public health professional with more than 8 years of experience. He is currently serving in Jepaigo as a Senior Program Officer, Family Planning, and State Nodal for Gujarat State. Post his medical studies, he did his MPH from Savitribai Phule, Pune University, and his MBA in Healthcare from D.Y. Patil University. He has worked in several public health programs such as family planning, COVID-19, cancer, digital health, maternal and child health, and public health advocacy initiatives. He started his career at Seva Rural at NGO from the tribal block in Bharuch district, Gujarat. In the Iron Techo project, which was later scaled up across Gujarat state as Techo Plus. His efforts contributed to a policy level and new budgetary allocations for improving the quality of family planning services in Maharashtra state. Currently, he is leading the implementation of newer contraceptive initiatives in 4 districts of Gujarat state. We kindly request his insights and expertise to enlighten the audience. Thank you, sir.
She spoke very good about me. Actually, मैंने ही लिख के दिया था. तो before I start, मेरे को 2 क्वेश्चन पूछना है. One is simple and one is difficult. How many of you love traveling? Okay, so you are in the best career field of your life. Because public health is all about traveling. It will give you a lot of opportunities to explore. And second difficult question, आप लोगों में से कितने लोगों को पता है कि मैं पब्लिक हेल्थ में क्यों हूँ? Means this is very important question. See, this is public health is not typical corporate job कि आपको 9 to 5 आना है, AC में बैठना है, काम करना है. पब्लिक हेल्थ ऑफिस में नहीं है. पब्लिक हेल्थ को समझना है तो आपको पब्लिक में ही जाना पड़ेगा. एंड जॉब का टेंशन मत लो. वो एक मैडम ने पूछा था कि मेरा BDS है और मैं क्या फील्ड में काम. आपको क्यों सोचना है ये? हेल्थ केयर में इतने प्रॉब्लम्स है कि आप इतना मत सोचो कि मुझे मैटरनल हेल्थ में जाना है या मुझे पॉलिसी लेवल काम करना है. डोंट थिंक अबाउट इट. जो जॉब मिले करियर के स्टार्ट में ले लो. तो सर ने जो क्वेश्चन बताया था ना कि आप फ्रेशर हो, आपको क्यों हम ले, तो आपको कोई तो अपॉर्चुनिटी मिलेगी कि कुछ तो प्रूफ करने के लिए. तो आप सबको पता है कि पब्लिक हेल्थ में डिफरेंट अपॉर्चुनिटीज़ है. गवर्नमेंट है, NGOs है, अभी हमारे यहाँ पे हेल्थ स्टार्टअप्स उनके भी रिप्रेजेंटेटिव्स है. तो डिफरेंट अपॉर्चुनिटीज़ है. ओनली द थिंग इज़ कि आप विलिंग हो करने के लिए. क्या आप वो एक्स्ट्रा माइल जाने को रेडी हो? आर यू रेडी टू लिव इन अ एनवायरनमेंट या ऐसे ऑर्गेनाइजेशन जहाँ पे आपसे ज़्यादा एक्सपेक्ट किया जा रहा है आपके लाइफ से, तो वो हमें फिगर आउट करना पड़ेगा। सेकेंड इज़ जपाएगो की अगर बात करें तो जपाएगो आप लोगों में से काफ़ी लोग जानते हैं, इट्स अ पब्लिक हेल्थ ऑर्गेनाइजेशन एफिलेटेड टू जॉन हॉपकिंस यूनिवर्सिटी एंड वी आर वर्किंग इन ऑलमोस्ट 29 states and Dr. Saurabh was also associated with Japaigo, although I didn't work with him directly. So currently Japaigo में यूजुअली क्या होता है ना, पब्लिक हेल्थ में अगर कोई भी पोजीशन है तो प्रोग्राम ऑफिसर नाम की पोजीशन होती है, जो एक एंट्री पॉइंट होती है जपाएगो में पब्लिक हेल्थ करियर स्टार्ट करने का। वो एक यूजुअली डिस्ट्रिक्ट लेवल पोजीशन होती है जिसमें जो भी प्रोग्राम्स चलते हैं उसमें डिस्ट्रिक्ट लेवल पे काम होता है एंड यू एज अ टेक्निकल पर्सन सपोर्ट द गवर्नमेंट और एनी प्राइवेट एंटिटी। सेकेंड उसके बाद प्रमोशन होता है सीनियर प्रोग्राम ऑफिसर, फिर स्टेट प्रोग्राम ऑफिसर, फिर नेशनल प्रोग्राम ऑफिसर, प्रोग्राम मैनेजर भी पोस्ट होता है। सो डिफरेंट लेवल्स होते हैं एंड बेस्ड ऑन योर एक्सपर्टीज़ एंड योर डेडिकेशन कमिटमेंट आप लोगों को प्रमोट किया जाता है। एंड बेसिकली जैसे सर ने बताया कि क्रिटिकल थिंकिंग बहुत इंपॉर्टेंट स्किल है, तो ये क्रिटिकल थिंकिंग ना इजीली नहीं आता है। जैसे जैसे आप पब्लिक हेल्थ में आगे जाओगे, अलग अलग लोगों से मिलोगे, प्रॉब्लम्स देखोगे ना, उसके बाद ही आएगा ये स्किल। बट यस, मुझे जो लगता है ना कि सबसे इम्पोर्टेंट जो स्किल है वो है स्टेक होल्डर मैनेजमेंट। आपका बिहेवियर कैसा है, आपके पीपल मैनेजमेंट स्किल्स कैसे है, ये तय करेगा कि आप करियर में कितना आगे जाओगे। देखो आप यहाँ से पढ़ के जब निकलते हो तो आपको बस एक प्रिपेयर किया है जॉब मार्केट में एंटर करने के लिए, बट उस जॉब मार्केट में जो लोग हैं वो तो डिफरेंट है, वो उनका एक्सपर्टीज डिफरेंट है, उनका एक्सपीरियंसेस डिफरेंट है और उनको पता है, और उनको आपको जाके अगर आप सिखाने बैठोगे ना कि सर ये ऐसे करना है ऐसे करना है, वो आपको बोलेंगे भाई तू जा। तो पब्लिक हेल्थ में स्टेक होल्डर मैनेजमेंट, रिलेशनशिप मैनेजमेंट ये बहुत इंपॉर्टेंट है। आज रिलेशन पे बेसिस पे ही पब्लिक हेल्थ प्रोग्राम्स चल रहे हैं। सी फंडिंग रिक्वायर्ड है, टेक्निकल एक्सपर्टीज रिक्वायर्ड है, बट अगर आपके कॉन्फिडेंस में सामने वाला नहीं है तो आप उसके साथ काम करोगे क्या? नहीं करोगे। तो ये स्किल आप ज़रूर डेवलप करिए कि हाउ यू मैनेज पीपल एंड योर इंटरपर्सनल स्किल्स। सेकेंड इज डॉक्यूमेंटेशन, जो डॉक्टर सौरभ ने बताया कि आजकल पता है जपाएगो में क्या पोस्ट है, डॉक्यूमेंटेशन एसोसिएट, डॉक्यूमेंटेशन कंसल्टेंट। बिकॉज आज पब्लिक हेल्थ में इतना नॉलेज है कि लोगों को डॉक्यूमेंट करने का टाइम नहीं, इसलिए ऐसे पोस्ट भी आ रहे हैं एंड दीज आर स्पेशलाइज्ड पीपल जो पब्लिक हेल्थ भी पढ़ के आए हैं। तो ऐसे नहीं कि आप अगर ऑफिस में बैठ के सिर्फ टाइपिंग कर रहे हैं, कुछ डॉक्यूमेंट कर रहे हैं। तो दिस इज़ ऑल्सो स्किल बिकॉज नॉलेज मैनेजमेंट इज़ ऑल्सो इम्पॉर्टेंट। हमारे ऑर्गेनाइजेशन में अभी एक रिक्रूटमेंट हुआ है नॉलेज मैनेजमेंट कंसल्टेंट। उसका काम यही है कि डिफरेंट प्रोग्राम्स का नॉलेज उठाओ, उसको समराइज़ करो और बाकी टीम के साथ शेयर करो ताकि डुप्लीकेशन ऑफ एफर्ट्स ना हो। तो ये इस तरह के भी फील्ड्स होते हैं एंड टेक्निकल नॉलेज ऑफ कोर्स आपको डेवलप करना रहता है जैसे जैसे आप जिस फील्ड में जाओगे। अब मेरा एक आपसे रिक्वेस्ट है जो टेक होम मैसेज में देना चाहूँगा कि डोंट बी स्पेसिफिक, क्योंकि जब हम पढ़ते हैं ना तो हमें क्या लगता है कि हमें पॉलिसी लेवल काम करना चाहिए, हमें कंसल्टेंसी देनी चाहिए, या फिर अभी जब मैं पढ़ रहा था तो हमें 2 ही ऑर्गेनाइजेशन पता थे, WHO और यूनिसेफ, और सबका सपना वही होता है मुझे WHO में काम करना है और आगे जाके मैं जिनेवा में काम करूँगा। तो ऐसा नहीं होता है भाई। वहाँ जो लोग बैठे वो 10-20 साल मेहनत करके वहाँ तक पहुँचे। मैंने जब मेरा करियर स्टार्ट किया था तो सेवा रूरल नाम का एक NGO है, आप लोगों में से काफ़ी लोगों को पता है, और यहाँ पे डॉक्टर शाह करके एक है, सोमेन शाह, तो वो वहाँ पे तब एसोसिएट हुए थे हमारे साथ एक प्रोजेक्ट में। तो सेवा रूरल NGO का अगर टाइम मिला है आपको तो कभी जाइए विजिट करने। तो ग्राउंड लेवल NGO से अपना करियर स्टार्ट करने का ट्राई करिए। डायरेक्ट आप ऐसा मत सोचिए कि मैं इंटरनेशनल NGO में ही जाऊँगा या एकदम बड़ी लेवल में जाऊँगा, दिल्ली, मुंबई ऐसे शहरों में, क्योंकि जो पब्लिक हेल्थ है ना वो आपको वो ट्राइबल एरिया में ही पता चलेगा। वहाँ की जो आशा है ना वो आपको रियल लाइफ बताएगी कि वो हेल्थ प्रोग्राम्स कैसे इंप्लीमेंट कर रही है, उसको क्या चैलेंजेस आ रहे हैं और लोग क्या सोचते हैं अपनी हेल्थ के बारे में। तो ट्राई टू गो इन पब्लिक हेल्थ फील्ड्स, डोंट गो फॉर इमीडिएटली ऑफिस लेवल जॉब्स, गो इन द फील्ड। सेकेंड, किसी भी ऑर्गेनाइजेशन को ज्वाइन करेंगे ना कम से कम 2 साल करिए वहाँ पे। तुरंत 6 महीने में 1 साल में आपको कोई अच्छी अपॉर्चुनिटी मिल गई, अच्छा पैकेज मिल गया, उसमें मत पड़िए, क्योंकि ना वो आपके CV में भी रिफ्लेक्ट होता है कि दिस पर्सन इज जॉब हॉपर, ही लाइक्स टू स्विच और ही एम्स फॉर मनी। ऐसा अगर कहीं दिख गया ना तो फिर डिफ़िकल्ट हो जाए, क्योंकि यूजुअली जो डोनर फंडेड प्रोजेक्ट्स होते हैं जैसे यूएसएड है या फिर BMGF है, बिल एंड मेलिंडा गेट्स फाउंडेशन, टिपिकली मैक्सिमम 3 या 4 ईयर्स के ही प्रोजेक्ट होते हैं। आजकल 5 ईयर्स का प्रोजेक्ट बहुत रेयरली दिखता है। तो ये जो 3 ईयर्स का प्रोजेक्ट होता है ना, इसको आप पूरा जिए, मतलब इसको पूरा घुस जाइए उसमें। आप बीच में ही छोड़ देंगे ना तो एक तो शायद आपका वहाँ से कोई रिसर्च पेपर निकलने वाला होगा तो उसमें नाम भी नहीं आएगा, एंड सेकेंड है वो आपके CV में भी दिखेगा कि ये बीच में छोड़ के चला जाता है। एंड ऑफकोर्स आपको पता है रेफरेंस चेक तो होता ही है। सो एटलीस्ट मिनिमम 2 ईयर्स एक NGO में या फिर किसी भी ऑर्गेनाइजेशन, इधर गवर्नमेंट हो NGO हो कहीं भी, मिनिमम 2 ईयर्स तो करिए। सेकेंड, अच्छा आप लोगों में से कितने लोग घर वालों को पता है कि पब्लिक हेल्थ क्या है? मेरे घर वालों को अभी भी नहीं समझता मैं क्या कर रहा हूँ। तो ये डायलेमा हमेशा रहेगा। तो पब्लिक हेल्थ अपने घर वालों को समझाने का टेंशन मत लीजिए, उनको बस इतना रहिए कि ये कुछ कंट्रीब्यूट तो हम कर रहे हैं ना। सी क्लिनिशियन क्या होता है, अभी आई डोंट वांट टू हर्ट क्लिनिशियंस ओवर हियर, बट क्लिनिशियंस पेशेंट आता है तो उसको चेक करते हैं। आपके डायरेक्ट या इनडायरेक्ट एफर्ट से हज़ारों लाखों लोगों की जान बचेगी, एंड दिस इज़ व्हाट ऑल ऑफ अस आर डूइंग इन पब्लिक हेल्थ। मैंने भी अपना करियर जब स्टार्ट किया था तो ग्रेजुएशन के बाद क्लिनिक खोल के बैठो, 3 महीने किया मैंने, अब पेशेंट ही नहीं आए। अब पेशेंट नहीं आएंगे तो पैसे कहाँ से आएंगे? फिर मैंने ब्रेक लिया और पब्लिक हेल्थ किया। तो इसलिए आपको पता होना चाहिए कि आप पब्लिक हेल्थ में क्यों हो, व्हाट इज़ योर पैशन। इफ़ यू लाइक टू वेट फॉर द पेशेंट यू गो फॉर क्लिनिकल प्रैक्टिस। अगर आपको लोगों में जाना पसंद है, इफ़ यू लाइक टॉक टू पीपल, अंडरस्टैंड देयर प्रॉब्लम, अंडरस्टैंड देयर कंसर्न्स एंड यूज़ योर नॉलेज एंड स्किल टू सॉल्व देयर हेल्थ प्रॉब्लम, फिर आपने पब्लिक हेल्थ में जीत लिया अपने आप को। सेकेंड, लिंक्डइन के बारे में बात की, तो लिंक्डइन अपडेट किया करो। जैसे कुछ भी आप लाइफ में करो, एक्टिविटी पब्लिक हेल्थ रिलेटेड, कुछ भी समझो आपने कहीं वॉलंटियर भी किया है ना, लिंक्डइन पे अपडेट करो। लोग देखते हैं, रिक्रूटर्स देखते हैं, वहाँ से ही कनेक्शंस होते हैं, वहाँ से ही नेटवर्किंग होता है। सेकेंड, लास्ट मुझे 2 लाइन ही बोलनी है कि ऐसा मत समझिए कि पब्लिक हेल्थ में सिर्फ डॉक्टर्स की ही चलती है। हमारे यहाँ पे नॉन मेडिको पब्लिक हेल्थ भी है। एंड आपको ये जान के मैं भी सरप्राइज होगा कि जपाइगो की जो बॉस है, जो ग्लोबल लीडर जो US में बैठती है, वो नर्स है। सो पब्लिक हेल्थ में इतना मत सोचिए कि मैं आयुष बैकग्राउंड से हूँ, मैं माइक्रोबायोलॉजी हूँ, मैं बायोटेक्नोलॉजी हूँ तो मेरा क्या होगा। नहीं, मेरी एक फ्रेंड है जो माइक्रोबायोलॉजी से, वो मुझसे भी बड़ी पोस्ट पे अभी, हम दोनों ने साथ में ही स्टार्ट किया था करियर। सो आई एम रियली हैप्पी। सो ये एक अपॉर्चुनिटी है। सेकेंड, डोनर मनी। याद रखिए कि आप जो भी पब्लिक हेल्थ प्रोग्राम्स में काम करेंगे ना, मोस्टली डोनर फंडेड प्रोजेक्ट्स होते हैं। अब डोनर फंडेड प्रोजेक्ट्स भी किसी का अर्न किया पैसा ही है, जो जिसने सोशल सेक्टर में दिया है डोनेट करके। तो आपको इंश्योर करना है जब भी आप फील्ड में जाएंगे या इस फील्ड में आओगे ना, कि उस पैसे को आपको जुडिशियसली यूज़ करना है, बिकॉज रिसोर्सेस आर वेरी लेस एंड टाइम इज़ मनी। लास्ट में एक ही सजेस्ट करूँगा कि रीडिंग करते रहो। तो यहाँ से पढ़ के जाओगे, आपने ऑलरेडी आधी अचीवमेंट क्या बोलते हैं उसको अचीव कर ली है, क्योंकि इतने अच्छे इंस्टीट्यूट से अगर आप पढ़ के जाओगे तो ऑब्वियसली जॉब मार्केट में आपकी वैल्यू होगी। बट अपने आप को अपडेट करना बहुत इंपॉर्टेंट है, और पब्लिक हेल्थ रिलेटेड नहीं, जो भी आपको नॉन फिक्शन फिक्शन जो भी पढ़ना है वो पढ़ो, क्योंकि इट विल मेक यू वाइज मैन वुमन। लास्ट में बस एक कोट कहना चाहूँगा, जो अभी रिसेंटली एक आर्नोल्ड, आप सबको जानते होगा, आर्नोल्ड को आप जानते होंगे ना, बॉडी बिल्डर, उनका एक बुक रिलीज हुआ है बी यूजफुल, रिसेंटली आया है। उसमें एक कोट है, एम्ब्रेस द पेन एंड डिस्कम्फर्ट दैट कम्स विथ हार्ड वर्क, दे आर सिग्नल्स ऑफ ग्रोथ एंड सक्सेस। ओके, थैंक यू।
Thank you, Dr. Akash. See, very important things he mentioned, like be ready to work in the grassroots. Policy बाद में बनाएंगे, don't worry for that. When they joined in the initial introductions, as Sir said, like you all, WHO, UNICEF and policy, these were the 3 things. And I'm sure towards the end of the first semester, now you are more convinced that we'll have to go to the grassroots, and then we will rise to all those things with your sincerity, dedication and hard work. Let's open up for questions if there are. Last.
Good afternoon, sir. So I was asking that you gave us a lot of suggestions about how to have a community approach. For someone like me who is more looking into going into the research perspective of public health, what would you suggest?
So you can join any good organization who are working in public health field, because at the same time जब public health का कोई project आता है तो implementation team अलग होती है. जैसे for example I am part of implementation team. तो हम लोग प्रोग्राम इम्प्लीमेंट करते हैं विद गवर्नमेंट. एट द सेम टाइम एक रिसर्च टीम भी होती है उसी प्रोजेक्ट में, क्योंकि क्या होता है जब डोनर प्रपोजल्स लिखे जाते हैं तो कुछ डोनर्स का ये मैंडेटरी होता है कि आपको 2 या 3 पब्लिकेशन निकालनी ही है, क्योंकि डोनर का भी नाम होना चाहिए ना. जैसे फॉर एग्जांपल मैं जिस लास्ट प्रोजेक्ट में था उसमें डोनर प्रपोजल में ही लिखा था कि 3 पब्लिकेशंस आर मैंडेटरी. तो एनी गुड ऑर्गेनाइजेशन हु आर इम्प्लीमेंटिंग द प्रोग्राम हैज़ रिसर्च टीम इन इट्स प्लेस. एंड ICMR है, जपाईगो में भी रिसर्च टीम है. एवरी ऑर्गेनाइजेशन हैज़. एंड अगर नहीं भी है तो आप ही कर सकते हो, बिकॉज यू हैव द स्किल्स एंड नॉलेज.
Thank you, sir.
Yeah, so as far as research goes, no, as Dr. Akash made a very valid point. The money that you're spending is somebody else's money and you're spending it on somebody else's priorities. And there is a lot of emphasis in the current scheme of things being placed on the research aspect of any program. Yeah, so I am personally party to discussions wherein we have set up a research arm which is 300-400 strong, only dedicated towards gathering data, analyzing data, presenting data, having a knowledge management exercise in terms of documenting that data, and based on these researches influence change at the policy level. Okay, so research, please don't think that it is parallel to public health or research is parallel to whatever it is that you're trying to do. Research in the current scheme of things is intrinsic to program management. And we are all subject to multiple checks and balances, multiple audits, multiple course corrections, and multiple knowledge generation responsibilities based on the research being conducted real time. Okay, so it's an intrinsic part. Thanks.
Thanks, sir.
Any other question?
See, if you are a good speaker, yeah, if you like to talk to people and listen to them and understand them, be positive, तो आप अपने communication skills manage कर लोगे. और ये ना over a period of time आपको आता है. मतलब सच बात बताओ तो ऐसे रियल इंसिडेंट्स भी हुए जब 2 बार मुझे गवर्नमेंट एम्प्लॉय ने डांट दिया था. क्योंकि ना ये जब मैं करियर के स्टार्ट में था ना, तो मुझे एक सर को मिलना था कि उनकी अपॉइंटमेंट लेनी थी कि हमें एक ऐसा ऐसा इवेंट करना है और आपके स्टाफ को भेजो. अब मुझे पता नहीं था कि उनका ऑलरेडी मूड ख़राब है क्योंकि उनके ही लोगों ने कुछ गड़बड़ कर दी है. तो ये होता है पब्लिक हेल्थ में, आपको डांट भी पड़ेगी और आपको ऐसा लगेगा कि यार ये मेरा बॉस नहीं है, ये मेरा इससे कुछ है नहीं, फिर भी ये मुझे डांट रहा है. अब उस टाइम पे अगर आप अपना कूल रखोगे ना, तो ये धीरे धीरे आप में अंदर आएगा कि हाउ यू मैनेज स्टेक होल्डर्स. तो आप नेक्स्ट टाइम मैंने क्या किया कि उसके पीयून से पूछा बॉस का मूड कैसा है, कि वो मूड देख के ही जाओ. हम लोग गवर्नमेंट में यही करते हैं, पहले से पता करते हैं कि कैसा है सामने वाले का मूड और फिर अप्रोच करते हैं. तो कम्युनिकेशन स्किल्स आ जाते हैं. एंड ज़रूरी नहीं है कि आपको इंग्लिश में ही बात करनी है. ज़्यादातर गवर्नमेंट में लोकल लैंग्वेज में ही काम चलता है. आपको पता है महाराष्ट्र में जो गवर्नमेंट लेटर्स निकलते हैं वो मराठी में निकलते हैं. इनफैक्ट यूपी, बिहार, झारखंड, मध्य प्रदेश, गुजरात, नहीं सर कुछ इंग्लिश में भी निकलते हैं. तो लोकल लैंग्वेज ही काम आएगी आपके. तो बी स्पेसिफिक एंड डोंट वरी अबाउट योर स्किल्स. हो जाता है.
Also, your
sorry sir. एक टिप मेरे को दिया गया था, yeah, not while I was here, in before I joined the social sector. As I said, I have been an entrepreneur set up a highly profitable business before selling it off. एक tip मेरे को दिया गया था when I was trying to raise money for this particular venture. And when we say stakeholder management, डॉक्टर आकाश ने एकदम वो स्पेसिफिक बात किया कि गवर्नमेंट फंक्शनरीज वगैरह के साथ आप बात कर रहे हो. प्लीज ऑल्सो अंडरस्टैंड दैट योर स्टेक होल्डर मैनेजमेंट एज यंग प्रोफेशनल्स also involves how you're dealing with the organization as at large. You have multiple people to manage. A successful professional is not somebody who only manages government counterparts. Nahi hoga. You have multiple stakeholders in every stage of your journey. And a tip that I hold very close to my heart is never bring in your personal biases to professional disagreements. Do not react emotionally to professional disagreements. Keep your emotions out of loop. आप जैसे घर में काम कर रहे हैं वैसे नहीं होता है बाहर काम. And you learn all this with experience. Your communication will evolve. The skills with you handle people will evolve. How you present things will evolve. However, all this will evolve only if you are prepared for that particular change. ये पिक्चर में दिखाते हैं ना कि मैं तो ऐसा ही हूँ भाई, मैं तो ऐसे ही काम करूँगा, हम तो ऐसे ही है, नाच नहीं चलेगा. You are nobody as a professional in the real world if you cannot temper your behavioral patterns and you cannot adapt to what is required at that juncture. और ये कोई साइंस नहीं है. It is not a science at all. You all develop. हम भी ये जो ज्ञान दे रहे हैं ये 20-25 साल काम करके लोगों से मिलके खुद के एक्सपीरियंस से लर्न करके ही दे रहे हैं. So please keep that at the back of your mind.
मैं एक चीज़ ऐड करना चाहूँगा जो आपने पूछा कम्युनिकेशन के लिए. तो पहला जो मैं पिछले 1 साल से थोड़ा थोड़ा यूज़ करता हूँ कि आपके पास स्मार्टफोन है, उसमें रिकॉर्डर है, ठीक है, उसको यूज़ करिए. जब भी कई बार मैं फ्री होता हूँ, गाड़ी चलाता हूँ, तो मैं स्मार्टफोन चालू रख के उसमें रिकॉर्ड करता हूँ. आइडिया पिच करना है ऑफिसर को कुछ कर, ठीक है. सो व्हाट आई डू इज दैट आई रिकॉर्ड माई दैट वो जो पिच है मेरी, मैं वो स्मार्टफोन में रिकॉर्ड करता हूँ और फिर मैं सुनता हूँ मेरे फिलर्स है, कहाँ पे मैं अटक रहा हूँ. तो दैट इज फर्स्ट थिंग, बहुत ईजी आप कर सकते हैं. दूसरी कि आपका कम्युनिकेशन एक किसके साथ कर रहे हैं, कौन सा स्टेक होल्डर है, ठीक है, और उससे मतलब आपकी क्या एक्सपेक्टेशन है और उसकी आपसे क्या एक्सपेक्टेशन है, पहले जान लो. अगर कोई बहुत बिजी आदमी है गवर्नमेंट में, उसके साथ बात करो तो डायरेक्टली आप पॉइंट पे मत आ जाओ, पहले उसको बैकग्राउंड देना पड़ेगा. जब मेरे साथ 25 टीम है और बहुत सारे प्रोग्राम्स हैं, तो मैं पहले सबसे उन लोगों को बोलता हूँ कि आप जब भी मेरे से बात करें पहले मेरे को कॉन्टेक्स्ट दो, ठीक है, और उसके बाद आपको क्या स्पेसिफिक सॉल्यूशन चाहिए वो आप बताइए. तो जब भी आप किसी से बात करें, खास करके जो गवर्नमेंट ऑफिसर्स वगैरह, तो पहले एक बैकग्राउंड दीजिए, मतलब पीपल आर वेरी बिजी, और उसके बाद आपको क्या उनसे सॉल्यूशन चाहिए, बी वेरी मच स्पेसिफिक. तो आपके जो स्टेक होल्डर हैं जिससे आप बात करें, उसके आधार पे आप जो है आपका कम्युनिकेशन जो है वो आप उसको टेलर मेड करिए, ठीक है. थैंक यू.
Thank you. We hope we will take the questions at the end. You can keep your questions written. So we move ahead to the next speaker. Also, see, towards the end, we will again open up. You can keep your questions ready. And if that time, if the questions are many more, we will have an informal interaction during our lunch break also. So we have enough opportunity to interact with them.
Thank you so much, Dr. Shinde. Your insights undoubtedly enhanced our collective understanding. Now, we kindly invite Dr. Sandeep Patel to provide a concise and enlightening overview for our audience. Dr. Sandeep Patel is a dynamic leader in healthcare administration. He presently serves as the founder and CEO of DocHub in Ahmedabad. Prior to this, he successfully led as the CEO of BT Savni Kidney Hospital in Rajkot, with roles such as Senior Executive at NM Virani Walcott Hospital, Rajkot, Executive at Sterling Hospital, Vadodara, and trainee at AIIMS, New Delhi. He has demonstrated excellence in overseeing hospital operations, patient care, and accreditation coordination. Over to you, sir.
Thank you very much, IIPHG Gandhinagar and ICIES organizers It's been second time visiting IIPH Gandhinagar, so feeling good. While attending this 3-day conclave, earlier before the communication for this conclave, and it was decided that you will be a part of the career talk, I shared that topic. I will be speaking career path and perspective of healthcare management, etc. And but during this 2 days interaction, last 2 days interaction with the students, I changed my topic and discussion, because already I thought that DocHub is already on a public domain. It's a web portal, healthcare job portal. People maybe know about it, not directly, indirectly. There are YouTube channel already. We are posting hospital management, leadership, healthcare related career videos. Then what should I talk to the students who are mix of the audience of public health as well as hospital administration? So I found a common things, and while sitting in your audience yesterday, I recollect my journey, professional journey, in that what drives me to this my career from medical background to finding the healthcare management field, working in hospital management, and then decided to health tech startup and all. So I think that what drives a particular person in their career, which I conclude that it is a mindset which drives you throughout your journey. And I also recollect in last 10, 12 years of my journey, what kind of different mindset I came across in my professional journey. And I didn't prepare PPT, but I list down 13 career mindsets which you among yourself also you will be, if you self-evaluate, you will come across. Whenever you join, your boss might be one of this mindset, your colleagues might be one of this mindset. So I want to share these things with you. And yes, no need to write down these things. You can always find this video on DocHub YouTube channel. That is fine. First mindset is blaming mindset. You will find people, they will find excuses whenever there is a work. Oh, I didn't find a cab, so I come late. Oh, I didn't got the funding, so that my startup didn't take off. Oh, I didn't find the right talent for this project, that's why this project got failed. So beware of these people. Try to not be like these excuse people. And if your boss is such kind of things, try to overcome this situation. Second mindset is clerk mindset. Just imagine the clerk, a typical 9 to 5, and showing the processes and all. I mean, anything, any work comes to his desk, he will first look at whether it is in my job description or not. If it is not, I will pass on to the next person. So this kind of mindset, the passing the ball mindset, maybe your colleagues might be in the, whenever you join, or maybe the boss, your boss may be such kind of mindset. If your boss having with this such kind of mindset, that will you in the trouble. So you need to find out the way where how you can take it further. And yeah, of course, I would not suggest that anybody, if self-evaluate it, don't be like such kind of clerk mindset. As sir has, earlier speakers has rightly point out, you need to go into the grassroots level. You cannot sit on table, initial career. It cannot be on a 2x2 mindset. 2x2 means, sitting on a laptop or PC and working on the data only. Third is jumping mindset. People will always, find, they will not stick to their words. They will always jump. Means if any discussion and things are already decided, and after a 1 month the work has already done or the project got failed or something, they will jump to the, oh, मैंने ऐसा नहीं कहा था, मैंने तो वैसा कहा था. You have did wrong these things. So again, that will be blame to on the person who have done on the level of grassroots level they have worked, and if something goes wrong, such people will jump. So try to not be like that. Take a responsibility, because it's a leadership skill. Whenever any success, you will find, even I also find during my career in corporates and any of the organization, people like, they will take a credit of success, but anything goes wrong, if failed, it is juniors' responsibility, or people who have working on that project, they have did wrong and it got failed. So that is a part of your game, and you need to manage that part. At least you should not behave like that. Take a responsibility of failure. Fourth is guided missile mindset. Guided missile means it has grade 1, 2 and 3 mode. Grade 1 is you might be require a little bit direction whenever any project or any assignment, new assignment came. Maybe you have not idea about that things. You get a direction from your manager. So that's a grade 1 mindset. It is good that first direction you get it, and then you can take it forward. You can execute at your own. You can find ways to manage and etc. But grade 2 is difficult, because such person will need 2 or 3 more direction after the first initial brief. So try to come to the grade 1, and grade 3 is worst. Each and every task, that person will come and, sir, मैंने आधा ग्लास पानी पी लिया है, आधा ग्लास बाद में पीऊँ तो चलेगा? Such kind of things. सर मैंने वो भेज दिया है, सर मैंने वो कॉल कर दिया है, फिर वो कर दिया है. Sir, everything, he will not be able to take a decision, that person, and also wasting a time of their seniors and the other colleagues also, while not confidently taking forward to the things. So these are the things that you need to be aware, and at least don't get into this. Fifth, executor mindset. It is fine that you cannot, you are not getting the visionary ideas, new creative things and all, but once your team or your manager or seniors have given you a particular vision or particular assignment or an idea, that person, if you are having an executor mindset, you will be well executed that particular things, assignment or project. So that's will drive your career further, because people knows that it is fine if he cannot creatively thinks for particular idea or any initiation, but yes, once it is decided, he will, that person is well executed. Everybody knows in a team that give that project to that person, he is a well executor. So at least be a good executor, because in India, once I was listening one of the founder, and he said India में 140 करोड़ लोग हैं, तो रोज के at least 140 करोड़ ideas तो आते ही हैं. What matter is execution. And sixth is initiator mindset. People who can initiate, they don't wait for the validation. Okay, oh, I didn't get the approval, so otherwise I would have started this project very well. I would have I should have given the responsibility, na? Then only I should work. Such kind of, that excuse mindset, come out of that mindset. Be an initiator. Initiate things. No matter whether you are in government organization or a NGO or a hospital, etc. If you been able to initiate a small thing and over a period of time, people definitely recognize your skills. And of course, you will get that leverage to your ladder in your professional journey. After that, developer mindset. Developer mindset is a, such person is always ready to do anything and everything to make the success of the particular assignment. That's the developer mindset. And basically, if people, students who are interested in entrepreneurship, the developer mindset has to be required. So self-evaluate yourself. Developer mindset doesn't, see that, oh, it's a Sunday, I will do it on tomorrow from Monday. Oh, Saturday I have a work, I will not be available. So developer mindset, do anything and everything to make it successful for any assignment or any project. So that's I would suggest that's the mindset you should have and you should carry in your starting career as well as in your professional journey. Another is materialistic mindset. This is, it's an important aspect. I have observed many young graduates, they are, the materialistic mindset means iPhone, laptop, car, etc. I know why it is important, because you might think that why it is important. Having an aspiration for the gadgets is good, but it will drive your career. Because if you need a particular expensive gadget, then you might choose a wrong career path just because of having a money or having a good salary. But if you are not interested in that particular subject or a field, you will not be able to perform well, and over a period of time it will stuck. Your career will be stuck, because the outcome nowadays in government also the outcome matters. If you are not been able to get an outcome for particular project, you will be transferred, or you will be, that's the reality, because government also has a goal and target to reach particular, because every government program also has a targets to reach, right? After that, job security mindset. Nothing wrong with that. If I'm from a poor economical background, of course my priority is a job security priority. But don't stick to it. Once you get that job security, first identify different areas and find your interest and your calling to the domain, and then go for it. Another important aspect is designation mindset. I am fascinated about the designation, but not been initiator kind of to understand the job role of that particular designation, and don't fulfill my job role. But yes, I want the designation. There are people, even on higher management also, there are people that they don't, justify the designation, but that's the reality. But at least you should not, as you're starting your career, do not get into this, that just because this company is giving you an assistant manager position, you join that way. Sometimes designations also are tricky. Identify, try to understand the job role, the job description, and self-evaluate that whether you are fit for this job or not. No matter whether you are joining as executive or assistant manager, in if you have gone through, in my profile, they have mentioned I have worked in executive, senior executive, and directly joined as a CEO. After 4 years, after 4 years of experience, I joined as a CEO in a particular hospital. So that doesn't matter that if you are working in a senior manager position, then only someone will consider you at a higher position. It's your craft, I would say. So work on your craft. Designation will always, if not as company A, then company B will offer you. At last, there are three. One is academic and research mindset. If you are having that particular mindset, choose your companies and choose your recruitment accordingly. Apply to that particular role, because you will be the, you have that mindset, so you will be more explore that particular role, and you will satisfy the requirement of that job. After that, leadership, that you cannot learn, it is inbuilt, and that you will get that mindset by working on ground different projects. Entrepreneur mindset, as we talk, if you have a developer, an initiator, and executor mindset, that's the entrepreneur mindset. Entrepreneur is equal to developer plus initiator plus executor. That's the definition of entrepreneur. So by ending this, all the mindset, another mindset I just came while sitting on this dais, there is khayali pulao mindset. ये कर लेंगे, वहाँ पे ये ज्वाइन कर लेंगे, और 4 साल में यहाँ, फिर उसके बाद ये, और फिर अब्रॉड, और फिर ये. That's the khayali pulao mindset. At least start with one. There are goals, write down it, but at least don't get into these unnecessary khayali pulao things. It will confuse you. At least start with one first idea, because if one thought is there about your career, start it, get people connected, related to your thoughts, and try it, at least for a pilot project during your student life also. So I'll end this talk with this mindset. I hope that every student, whether it is hospital administration or public health, you will find something take-home message for your career. Wishing you all the best. And if anyone who have we want to build or you want to groom in a developer mindset, DocHub has opened 20 positions for executive business development across India, different locations. You can join DocHub, you can apply. Of course, on DocHub jobs portal, the same vacancy will be there. Apart from that, there are different, there are 42,000 healthcare jobs vacancies available on DocHub jobs. You can explore that also. And thank you very much for this talk. Thank you.
Thank you, sir. So I'm sure you must be now thinking which mindset you have. And so any questions on that? Okay, you can, if there are no immediate questions, then you can keep on writing it. We will take up after all the panelists speak up. So I now request the next.
Thank you so much, sir. Up next, we have Dr. Dilip Parmar. Dr. Parmar is currently serving the Health Division of Torrent Group, CSR, as an Assistant General Manager, looking after the North Gujarat and Saurashtra region. He is supervising 3 pediatric centers and field activities in approx 650 villages. He worked at Gender Health, US NGO, as a clinical training specialist in Ahmedabad, and monitored and coordinated all family planning related activities for Gujarat and part of Rajasthan for 1.5 years. He served WHO as a surveillance medical officer and was looking for strengthening of routine immunization along with AFP and VPD surveillance at Uttar Pradesh for 2 years. He has also served Rajkot Municipal Corporation, Rajkot, Gujarat as Deputy Health Officer and RCHO for 3 years. He has completed Diploma in Public Health from Community Medicine Department, BG Medical College, Ahmedabad, Gujarat, with 2 years of teaching experience in Public Health Program Management. We request you to enlighten and captivate our audience with a comprehensive briefing.
How are you all? How are you all? Okay. One of our surgery professor used to say, our mind is just like a sponge. It gets saturated after 45 minutes of concentration. So I can able to see many of sponge are saturated. So just to refresh it, I would like to start my session with basics of public health. आप सभी लोग जब सवाल कर रहे थे तो सबके एक ही तरह के सवाल मुझे लग रहे थे. That is the core of public health. Why, where, who, when, how and likewise. तो सवाल ये है कि क्या करें, कहाँ जाए, किस जगह पे जाए, किस एक्टिविटी में पार्टिसिपेट करें. राइट? आई एम नॉट एबल टू गेट द प्रॉपर रिस्पॉन्स. आई एम राइट? ओके. तो अभी अभी एक रिसेंटली रिलीज हुई मूवी है घूमर, शायद आप में से किसी ने देखी हो. उसका एक फेमस डायलॉग है कि हम सोचते हैं कि लाइफ इज ऑल अबाउट लॉजिक, बट इट इज ऑल अबाउट मैजिक. और ये जो मैजिक है वो सरलता से जीवन में आता नहीं है. अभी डॉक्टर संदीप ने कहा कि मेजॉरिटी ऑफ अस कोई ना कोई माइंडसेट से चलते हैं, बट मेजॉरिटी ऑफ अस का माइंडसेट क्या होता है? जैसे हम काफ़ी इंटरव्यूज़ करते हैं जीएनएम्स के, अदर डेजिग्नेशंस के, उनको पूछते हैं कि आपने ये नर्सिंग फील्ड क्यों चुना है एजुकेशन के लिए, तो उनका जवाब रहता है कि इसमें जॉब मिल जाती है. अब आर यू डूइंग इट फॉर जॉब? यस और नो? इफ यू आर डूइंग इट फॉर जॉब देन फिर वही सिलसिला है कि बस टाइम जा रहा है, यू आर किलिंग द टाइम, नो इंटरेस्ट. दूसरा है मैजिक. जिस जगह पे जाके आपको ऐसा फील हो कि आपको समय याद नहीं है, वो जगह रियल मैजिक है आपके लिए. वो करिए. ये अगेन फिर 3 इडियट्स हो जाएगा कि एक्सेलेंस के पीछे भागिए. जो भी आपके मटेरियलिस्टिक गोल है वो आपके पास आएंगे ही आएंगे. तो एक्सेलेंस के पीछे भागने के लिए सबसे पहले सब आइडियलिस्टिक एग्जीक्यूटिव मर्सिडीज, आईफोन, लैपटॉप्स ये सब नहीं मिलेगा. जैसा डॉक्टर आकाश ने कहा कि फील्ड में जाके आशा वर्कर से पूछिए कि वो कैसे मैनेज करती है. जब इस माइंडसेट से चलेंगे तब जाके आप उस लोअर लेवल एज वेल एज अपर लेवल सारे स्टेक होल्डर्स से निगोशिएट कर पाएंगे. स्टेक होल्डर्स निगोशिएशन स्किल की भी हमने डिस्कशन की. राइट? तो सबसे पहला आप एंट्री में, अभी आप तो खैर सभी लोग इतने इंटेलेक्चुअल लेवल आपका सभी का बहुत ही अच्छा है. जैसा अनूप सर ने बताया, हमने जब स्टार्ट किया था तो ऐसी जानकारी भी नहीं थी कि हम में क्या स्किल है. राइट? मैं राजकोट सिविल हॉस्पिटल में था तो पेशेंट्स चेक करता था इमरजेंसी में. हर बार एक ही तरह के पेशेंट. मैं ऐसा सोचता था कि इसके लिए इंसान की क्या ज़रूरत है, अगर मुझे सिमिलर काइंड ऑफ ट्रीटमेंट ही प्रिस्क्राइब करनी है तो जैसे किसी कंपनी के एंट्री में आप वो जो लॉगिन पास निकालते हैं, क्या कंप्लेंट्स है, तो फीवर, कफ, कोल्ड ऐसे करके सिंस 3 days तो करे तो सीधा प्रिस्क्रिप्शन आ जाएगा। इसके लिए किसी इंसान की क्या ज़रूरत है, और कब तक ये डिसीज चलेगा, क्या कोई इसका एंड है? वहाँ से पब्लिक हेल्थ जाग रहा था, ऐसा लग रहा था, मुझे नहीं पता था। अहमदाबाद सिविल में कम्युनिटी मेडिसिन डिपार्टमेंट में फर्स्ट जो इंटरव्यू हुआ, एडमिशन लिया, 1 महीने तक एजुकेशन चालू रखा। उसके बाद में सेकंड इंटरव्यू में काफ़ी सारी ब्रांचेस मिल गई थी, पर छोड़ने की इच्छा ही नहीं हुई कि मुझे यहीं रहना है, कहीं नहीं जाना है, राइट। जैसा डॉक्टर आकाश ने कहा कि अभी घर वालों को ये समझ नहीं है कि पब्लिक हेल्थ क्या है, अभी भी नहीं है। और जब भी कोई सवाल पूछता है कि ये क्या करते हैं, तो कि टोरेंट में जॉब करते हैं, राइट। उनको नहीं समझ है कि पब्लिक हेल्थ क्या है, पर वो एक अभी उसका इलाज ढूंढने जाएंगे तो आप अपने काम पे फोकस नहीं कर पाएंगे। आपका इंटरेस्ट है, आप कर रहे हैं, आपको मजा आ रहा है, वो सबसे ज्यादा जरूरी है, राइट। तो सबसे पहले यू फील, राइट। और आप इनिशियली बहुत ज्यादा इंटरेस्ट वर्दी जॉब में जाना चाहेंगे ऐसा मत सोचिए, पहले स्टार्ट करिए। आप जिस भी संस्था ऑर्गेनाइजेशन से जुड़ेंगे कुछ न कुछ सीखेंगे, कुछ न कुछ सीखेंगे। आप जिस भी इवन वर्स्ट ऑर्गेनाइजेशन इज हैविंग फ्यू ऑफ क्लास लर्निंग्स, तो आप धीरे 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 अपने आप को एक्सप्लोर करेंगे, ऑर्गेनाइजेशन को एक्सप्लोर करेंगे, थोड़ा समय देंगे, राइट। तो आगे जाके कुछ न कुछ ऐसा मटेरियलिस्टिक इंसाइट डेवलप होगा जो आपको यूजफुल होगा, राइट। तो सबसे पहले ट्राई टू एक्सप्लोर योरसेल्फ। ये कैसा है कि आपका जो मैजिक है वो ताला है, आपके पास चाबी का जूड़ा है, ये सारे ऑर्गेनाइजेशन से चाबी लगाते जाइए, चाबी लगाते जाइए, कोई एक पॉइंट ऐसा आएगा कि वहां से ताला खुल जाएगा। जहां पे ताला खुला समझिए ये आपका इंटरेस्ट है। आप काम कर रहे हैं, ना घड़ी दिख रही है, ना एपेटाइट दिख रही है, वो है असली मैजिक। और ये काम अगर चुनेंगे तो फिर ऐसी कोई भी जगह नहीं है जहां पे आपको डिस्कंफर्ट होगा, कुछ भी नहीं होगा, फिर भी मजा आएगा। सुबह से शाम तक घर जाएंगे तो शाम में जाके चाय की जरूरत नहीं रहेगी। आपका वर्क इटसेल्फ वर्क्स एज चाय, राइट। तो इसी के साथ जो है हमारा कैरियर टॉक शुरू करते हैं। थोड़ा सा मुझे लगा कि आपके क्वेश्चंस थोड़े इस तरफ कॉन्सेंट्रेटेड है, तो थोड़ी सी अलग शुरुआत करने की कोशिश की। जो हमारी टोरेंट ऑर्गेनाइजेशन है उसके बिहाफ में हमारी कॉर्पोरेट सोशल रिस्पॉन्सिबिलिटी की एक्टिविटीज चलती है। ओके, नहीं ओके, तो जो सारी एक्टिविटीज है उन जो सारी एक्टिविटीज है जो सारी एक्टिविटीज है उसको मैं इतना डिटेलिंग नहीं करना चाहूँगा, क्योंकि आपका इंटरेस्ट जो है उस पर हम थोड़ा सा ज़्यादा फोकस करने की कोशिश करेंगे। मैं टोरेंट ग्रुप में एज ए असिस्टेंट जनरल मैनेजर पिछले 6.5 साल से जुड़ा हुआ हूँ। सबसे पहला सवाल आप में से कई लोगों को होता होगा कि भी ये कॉर्पोरेट सोशल रिस्पॉन्सिबिलिटी, इतना बड़ा जो वर्ड है वो है क्या। काफ़ी सारे लोगों ने डिटेलिंग भी किया होगा, पर कुछ लोगों को जानकारी नहीं होगी। तो स्मॉल में हम इसको CSR कहते हैं। गवर्नमेंट का एक रूल है, कुछ क्राइटेरियाज है कि किसको कंपल्सरीली CSR करना है। CSR मीन्स ऐसी नोबल एक्टिविटीज जो किसी न किसी सोशल कॉजेस पे डिपेंडेंट है। तो क्राइटेरियाज क्या है, तो एक तो है कि कंपनी की नेट वर्थ, एसेट माइनस लायबिलिटी इज नेट वर्थ, 500 करोड़ से ज्यादा हो। टर्नओवर जो है वो 1000 करोड़, जो सेलिंग है अमाउंट वो 1000 करोड़ से ज्यादा हो। नेट प्रॉफिट जो है 5 करोड़ से और मोर हो, तो इसमें से कोई एक या एक से ज़्यादा क्राइटेरिया कोई कंपनी फुलफिल करती है तो एज पर गवर्नमेंट रूल उसको 2% मिनिमम स्पेंड करना पड़ता है सोशल कॉजेज पे, राइट। कुछ इनिशिएटिव्स है जो टोरेंट करती है। टोरेंट का नाम शायद आपने इलेक्ट्रिसिटी के फील्ड में सुना होगा। टोरेंट पावर है, टोरेंट फार्मा है, टोरेंट गैस है। तो ये तीनों एंटाइटी जो है प्रॉफिट बेस्ड है। जो CSR एक्टिविटीज है वो UNM फाउंडेशन के नाम पे नॉन प्रॉफिट ऑर्गेनाइजेशन सब्सिडियरी है। तो इसमें एक तो प्रिवेंटिव एक्टिविटीज हम लोग करते हैं। प्रिवेंटिव एक्टिविटीज में हेल्थ स्क्रीनिंग कैंप्स करते हैं विलेज लेवल पे। गुजरात में मोर देन 1600 कैंप्स हम लोग कर चुके हैं। नॉर्थ गुजरात में हमने 650 प्लस स्क्रीनिंग कैंप्स किए, जिसमें हम एनीमिया, माल न्यूट्रिशन, सीरियस डिसीजेज वाले बच्चे उनको ढूंढते हैं और उनकी रेगुलर फॉलोअप से ट्रीटमेंट करते हैं। क्यूरेटिव है, सूरत कामरेज में हमारा 150 बेडेड पीडियाट्रिक मल्टी स्पेशलिटी हॉस्पिटल है और अक्रॉस द गुजरात हमारे 9 ऐसे सेंटर्स है जहां पे हम पीडियाट्रिक प्राइमरी हेल्थ केयर प्रोवाइड करते हैं, OPD, डे केयर, लेबोरेटरी, फार्मेसी एटसेट्रा। तो ये सारे जो सेंटर्स है वो भी प्रिवेंटिव एज वेल एज क्यूरेटिव एस्पेक्ट्स पे काम करते हैं। थर्ड वन इज अवेयरनेस। अवेयरनेस में हम एडोलेसेंट गर्ल्स में मेंस्ट्रुअल हेल्थ एंड हाइजीन पे काम करते हैं और इसके अलावा जनरल हेल्थ एंड हाइजीन, एनीमिया, माल न्यूट्रिशन, इनकी भी हम लोग अवेयरनेस करते हैं कम्युनिटी में जाके। अवेयरनेस के लिए शायद आपने एक शब्द सुना होगा, बिहेवियर चेंज कम्युनिकेशन। पहले हमारे जमाने में IEC शब्द यूज हुआ करता था, दैट इज इंफॉर्मेशन, एजुकेशन एंड कम्युनिकेशन, बट इट वाज अपग्रेडेड टू बिहेवियर चेंज कम्युनिकेशन। क्यों? क्योंकि आप इंफॉर्मेशन दे रहे हैं, उससे सामने वाले को कोई लेना देना नहीं है। आप कई सारी एड्स देखते होंगे टीवी में, वो डीओ स्प्रे पूरा ऐसे लगाता है, लड़कियां नजदीक आ जाती है, उससे कोई डीओ नहीं खरीदता, राइट। आपके इंफॉर्मेशन से कुछ भी नहीं होता। अगर आप सामने वाले के बिहेवियर में कोई चेंज ला सकते हैं तो वो असली अवेयरनेस है। तो ड्यूरिंग इम्पैक्ट असेसमेंट हमने देखा कि एनीमिया के जो बच्चे जो हमने ट्रीट किए थे बिफोर 3 और 4 इयर्स, उन्होंने सस्टेन किया अप टू 95% ऑफ नॉर्मल बच्चे जो थे वो नॉर्मल रहे इवन आफ्टर 3 to 4 इयर्स। ऐसे ही माल न्यूट्रिशन में मोर देन 80% ऑफ नॉर्मल जो बच्चे हैं उन्होंने सस्टेन किया इवन आफ्टर कंप्लीटिंग द ट्रीटमेंट। तो ये कुछ इनिशिएटिव्स है। इसके अलावा हम लोग हेल्थ एजुकेशन पे भी काम करते हैं, आर्ट एंड कल्चर डेवलपमेंट पे भी काम करते हैं, गार्डन डेवलपमेंट्स में भी काम करते हैं। तो ये कुछ डिफरेंट फील्ड्स है जहां पे टोरेंट CSR काम करती है। अभी सवाल है कि साहब हमारा क्या फायदा है, CSR में हमारी क्या अपॉर्चुनिटी है, राइट। तो ये MPH ग्रेजुएट्स है, मेजरली MPH ग्रेजुएट्स फील्ड जॉब के रिलेटेड ज़्यादा उनकी अपॉर्चुनिटीज रहती है, पर हमारे हॉस्पिटल्स में भी इनका अभी रोल धीरे धीरे डेवलप हो रहा है। आपके ही एक फॉर्मर ग्रेजुएट है MPH हेतवी चौहान करके, जो हमारे सूरत कामरेज वाले हॉस्पिटल में है एज ए मैनेजमेंट ट्रेनी। तो डेजिग्नेशंस कुछ भी हो सकते हैं। ये जस्ट एक ग्लिम्स है, ये ऐसा नहीं है कि ये सारे डेजिग्नेशन हमारे यहाँ अवेलेबल है। ऐसे डिफरेंट CSR में हम ऐसे डेजिग्नेशंस है जहाँ पे आप काम कर सकते हैं, बट दिस इज जस्ट अ ग्लिम एंड दिस इज नॉट एन एग्जॉस्टेड लिस्ट। तो एक तो प्रोजेक्ट कोऑर्डिनेटर है, जो छोटे छोटे प्रोजेक्ट्स है उसमें आप एज ए सीनियर लीड भी आफ्टर एक्सपीरियंस काम कर सकते हैं। सारे प्रोजेक्ट की सारी एक्टिविटीज आप जैसे कि प्लानिंग से लेके इम्प्लीमेंटेशन, डेटा मैनेजमेंट, ये सारा काम एक साथ भी कर सकते हैं एज ए सीनियर लेवल। सेकंड है कम्युनिकेशन स्पेशलिस्ट। कम्युनिकेशन स्पेशलिस्ट, अभी कम्युनिकेशन भी एक सॉफ्ट स्किल है, सबके अंदर दिखेगी नहीं। जब आपको सवाल होगा कि किसी एक इंसान को सुनने में मजा आता है, दूसरे इंसान को सुनने में मजा नहीं आता, ऐसा क्यों? ऐसा जब सवाल मन में होता है तो समझिए कि आप कम्युनिकेशन सीखने की शुरुआत कर रहे हैं। वन ऑफ आवर ओल्ड प्रोफेसर यूज्ड टू टेल अस, audience is your mirror. Try to feel the reflection. अभी सबके चेहरे दिख रहे हैं, सबके चेहरों पे उदासी, मोबाइल में देख रहे हैं, एक दूसरे से बात कर रहे हैं, स्नैक्स का मजा ले रहे हैं, और आपकी तरफ कोई नहीं देख रहा, राइट? तो समझिए कि कहीं ना कहीं आप में दिक्कत है, सामने वाले ऑडियंस में कोई दिक्कत नहीं है. ट्राई टू फील द रिफ्लेक्शंस, राइट? और अभी खैर ऐसा भी नहीं है कि कम्युनिकेशन के आउट ऑफ पब्लिक हेल्थ स्कोप नहीं है. आपने शायद जितेंद्र अढ़िया, डॉक्टर जितेंद्र अढ़िया का नाम सुना होगा. गुजरात में काफी ट्रेनिंग सेमिनार्स करते हैं. प्रेरणानु झरनु वाज द फर्स्ट बुक थी उनकी. तो वो एमडी कम्युनिटी मेडिसिन है. आफ्टर स्पेशलाइजेशन इन मेडिकल फील्ड ही स्टार्टेड करियर इन कम्युनिकेशन. तो अभी मोटिवेशनल स्पीकर्स का जमाना है, तो उस लाइन में भी अगर आप अच्छे कम्युनिकेटर है तो आप कहीं भी अच्छा कर सकते हैं. लाइक स्टेक होल्डर मैनेजमेंट में भी इसका काफी अच्छा रोल है. डेटा स्पेशलिस्ट, इफ आपको गैजेट्स का शौक है, आपको डेटा का शौक है, तो डेटा तो आप किसी भी प्रोग्राम में जाएंगे, डेटा जनरेट होने वाला है और उसी डेटा के बेसिस पे पूरे प्रोग्राम का रिप्रेजेंटेशन होता है. तो डेटा स्पेशलिस्ट भी एक इसेंशियल, इट इज ए इंट्रिंसिक पार्ट ऑफ एनी प्रोग्राम. आपको पार्शियली भी हो सकता है, फुल्ली भी हो सकता है. एपिडेमियोलॉजिस्ट, कई लोगों को डिसीज और उसके इवेल्युएशन, जो कैसे इवोल्यूएट हुआ था, इटियोलॉजी, इन सब में इंटरेस्ट होता है. ऐसे भी वर्क प्रोफाइल्स होते हैं. पब्लिक रिलेशन ऑफिसर, तो पब्लिक रिलेशन ऑफिसर भी एक कॉमन डेजिग्नेशन हो गया है किसी भी ऑर्गेनाइजेशन, इवन हॉस्पिटल्स में भी, दोनों के लिए एप्लीकेबल है. रिसर्च एनालिस्ट, रिसर्च एनालिस्ट, तो जैसा उन्होंने क्वेश्चन पूछा था कि रिसर्च के लिए क्या स्कोप है, तो अभी सारे ऑर्गेनाइजेशन में रिसर्च भी एक इंट्रिंसिक पार्ट है. एमएचए ग्रेजुएट्स के लिए एक तो हॉस्पिटल मैनेजर रहता है, कोऑर्डिनेटिंग ऑल हॉस्पिटल एक्टिविटीज. एडमिन इंचार्ज रहता है जो एडमिनिस्ट्रेटिव जो भी कोऑर्डिनेशंस है करते हैं. डेटा स्पेशलिस्ट, अगेन क्वालिटी स्पेशलिस्ट, वन ऑफ आवर योर एक्स ग्रेजुएट इज वर्किंग विथ अस, साधना लुहार करके, जो क्वालिटी स्पेशलिस्ट है हमारी हॉस्पिटल में. तो पब्लिक रिलेशन ऑफिसर एंड इन्फेक्शन प्रिवेंशन स्पेशलिस्ट. तो हॉस्पिटल में भी डिफरेंट डायमेंशन है जहां पे आप लोग काम कर सकते हैं. तो ये कुछ फ्यू ऑफ डेजिग्नेशन से, डेजिग्नेशन अलग हो सकते हैं, पर आप पहले जब एंट्री लेंगे तो धीरे धीरे एवरी फील्ड में काम करके आप अपना इंटरेस्ट इवेल्युएट कर सकते हैं. तो आपके कोई क्वेश्चंस हो इसके रिलेटेड तो आप लोग पूछ सकते हैं. यस.
First of all, let me thank Dr. Dilip Parmar for such a wonderful insights from various things, and try to also see that you all are not only interested in the mobiles and the snacks, so have some interaction here also. So the question, yeah, you can start the question.
Good morning, everyone.
Good.
Thank you very much for the lecture. Sir, I just want to know that in the CSR, can we treat the poor patients in our hospitals?
Yes. Every almost every activity of our CSR is free of course. There is no charge, and our Surat Kamraj Hospital is free for underprivileged people. For those of affluent class, it is with a no profit, no loss basis at a minimal cost.
No, like sir, like any big hospitals, like Zydus Hospital is doing a CSR.
Okay.
So like sometimes the patient comes, we know that the condition also very rare.
Yes.
You know, so if we operate on the case, it will be good for the advertisement also and success stories also. But they couldn't afford the bills.
Yes.
So the same hospital can do the surgery under CSR.
Yes. We have done around 1,500 surgeries in till last month, and we are doing it all. It is free of cost for underprivileged people. Anybody is having a poor class, so we provide them free of cost facility. For affluent class, it is with a minimal charge. Each and every super specialty surgery is being done at our hospital.
Thank you, sir.
Okay.
Hello. I think your question is that private hospitals, how can they get the benefit with this CSR, So for that, every company who comes under this, sir has shown this criteria, right? The big companies in these three criteria, of course, they need to spend 2% of their profit under CSR. Now what happened? Such company will define a CSR committee. So if your hospital is interested with that company for the CSR tie-ups, you need to contact their CSR committee, and every company whose CSR project is going on, I think sir will aid upon it, that they have yearly defined, these are the areas where our company will do CSR activity. So in that, if in their priorities, if healthcare or a patient care, or they will provide a poor patient for their surgeries and fund, it should be there in their CSR activity report or CSR activity initial things with which the committee is defined. So your hospital need to tie up with that company's CSR committee. So that way, I think I am rightly put it. Yeah. Thank you.
So, thank you, sir. We will take up towards the end then. So thank you.
Okay. Thank you.
Thank you, Dr. Parma, for your valuable insights. Moving ahead, we invite Dr. Purav Gandhi to kindly brief and enlighten us. Dr. Purav is a physician entrepreneur, currently working as the founder and CEO of HealthArc Insight, a global management consulting firm focused on strategy, analytics, and digital transformation. He is also a founder, investor, and strategic advisor for some healthcare innovators, including Vox Analytics, that is acoustic biomarker venture, Advino Healthcare, focused on home healthcare, and Insights 10, an AI-driven market research firm. He has several international publications and patents to his name, and currently he teaches about health informatics and AI in healthcare at IMK. Handing over the mic to you, sir.
Thank you, everyone. I think it's very nice to come back to IIPH Gandhinagar. Been here a few times. I've seen the institute evolve, interacted with the students. Coming from management consulting as a background, and also on the entrepreneurship for-profit side, I feel like I sometimes do get these questions that are all public health students. This is not maybe closely aligned to our mission. So I thought I'll start with a story around that. Within this group, like how many are from Gujarat? Majority, half of you are from Gujarat, right? So, and everybody is familiar with Mahabharat? Yes. Like all these Pandavas, right? They went for Vanvas for a year, and they were roaming around India, going from state to state. And at one point, they really get lost. They're not able to figure out where they are because उस ज़माने में GPS नहीं था, maps नहीं थे. And Yudhishthir was very thirsty. So he sends Arjun, if you can find out water for me. So Arjun इधर-उधर घूम रहे थे, भटक रहे थे. And then he comes across a well. तो वहाँ पे he goes to fetch water, and suddenly is a gentleman who comes up and he says कि ये कुआं मेरे पूर्वजों ने बनाया था. And now I have no means to earn money. So you'll have to pay me 10 rupees for the water. Arjun के पास पैसे नहीं थे. So he comes back to Yudhishthir and says कि I couldn't get the water, but I definitely figured out where we are. We are in Gujarat, right? So we are a land of entrepreneurship. Back then we knew how to make money from water, how to make progress on everything. And so that is entrepreneurship, right? So I'll tell you a little bit about my journey. So my doctor did my MBBS from NHL Medical College. I'm Tapasvi sir's student. Then I went and did my MBA. After my MBA, I went and joined an MNC consulting firm, Deloitte. I worked there for 5 years, initially in strategy consulting, where we were advising clients in terms of where they should grow, what kind of products they should launch, how should they price their products, and different things. Within Deloitte, they were starting a small venture in healthcare analytics. And I got a chance to be a co-founding member within that team. And I tasted entrepreneurship there. Being a Gujarati, then I came back to Ahmedabad. Had a couple of earlier ventures, both of them failed. But the entrepreneurship bug kind of persisted. And then I started Health Arc. Now it's been almost 8 years in that journey. We are a consulting firm of around 100 people. Now we have offices in Ahmedabad, Bangalore, and Hyderabad. Been associated with IIPHG and recruiting here for, I think, almost 4 years now. Within consulting, we do various types of work. There are primarily 4 things that we as a company do. One is strategic advisory around growth. So this includes studying key things like I told about, कि कौन से product launch करने चाहिए, कौन से market में, how much should you price, how to build a team around it, what kind of problems will you face. The second area is called as real world evidence. इसमें we look at a lot of historical data and based on the data identify what is working and what is not working in healthcare, and उसके basis पे we make decisions. Third area is data analytics and artificial intelligence, which is kind of the buzz right now. And last is digital transformation, which is basically trying to figure out how to use technology to improve healthcare, make it more efficient. I'll not go into too many of those details. It's available on our website. You can interact with some of your alumni who work at Health Arc. I'll just mention a couple of examples of work we do on the public sector and impact sector side, and consult to just demonstrate the fact that consulting for-profit companies also work in the impact sector. So currently we are doing one project for Niti Aayog. Niti Aayog is, as you would know, the main think tank of India. One of the programs that Niti Aayog runs for the Prime Minister's office is called a State Support Mission. So what they have done is they have made all the states, the government at the central level has made all the states compete. तो इनको ये बहुत सारे पैरामीटर्स पे रेट करते हैं कि स्टार्टअप सेक्टर में कैसे कर रहे हो, हेल्थ केयर सेक्टर में कैसे कर रहे हो, इलेक्ट्रिसिटी में, एंड देन दे प्रोवाइड इंसेंटिव्स टू दी स्टेट्स. तो बाय क्रिएटिंग हेल्दी कॉम्पिटिशन द गवर्नमेंट इंटेंड्स की ऑल द स्टेट्स हैव ग्रोथ इन इंडिया. बट नाउ टू जनरेट ग्रोथ इज़ नॉट ईजी, क्योंकि गवर्नमेंट में भी दे ऑल्सो हैव अ पीपल प्रॉब्लम, दे डोंट हैव मैनी पीपल. तो हर एक स्टेट में कुछ 5-10 स्टार IAS ऑफिसर्स होते हैं. इफ़ देयर इज़ अ फ्लड तो भी वो वहाँ चले जाते हैं. अगर नया स्कूल खोलना है वो कर लेते हैं, अस्पताल बनाना है, दैट इज़ ऑल्सो द सेम पर्सन डज. एंड दे फिगर ऑल दिस आउट, दे डू अ ग्रेट जॉब, बट देन ऑल द लर्निंग्स गेट लॉस्ट. तो what they are building is a knowledge portal where all this knowledge of excellent work that the government has done at scale is preserved, and any new IAS officer, district block officer, if they have a question कि मुझे आयुष्मान भारत का एक e-संजीवनी clinic start करना है, so they can just ask a question on that portal and the portal will give an answer. So there are 22 sectors under that program. We are the exclusive knowledge partner for healthcare and life sciences sector. Healthcare and life sciences, there are 13 subsectors that come under healthcare and life sciences. There are more than 6 ministries actually which together come and run healthcare in India. And we are building that entire knowledge repository of 1200 plus policies, different sector documents, case studies. More than 500 case studies have been collected, which will eventually be used by different public health workers and government officials. So this is just one example of kind of work that sometimes from private sector can also do in generating impact. Don't want to go into too many of those details. I think a lot of career insights have already been covered. Couple of things I would just add before I close. So like sir said, ki grassroots level pe, right, doing things is very, very important. If you don't do that, there is no reality check in terms of what you know. But उसके साथ one thing I have also realized working in consulting sector is you might not be formulating the policy today, but you should always ask that question to yourself कि while I am implementing this program and let's say running a public health camp, अगर मुझे ये पॉलिसी डिज़ाइन करनी होती टू क्रिएट एन इम्पैक्ट तो मैं कैसे करता? If you keep asking that question regularly, there is a very high chance कि tomorrow you will get an opportunity to make that policy. It will never happen कि पहले मुझे वो opportunity मिलेगी फिर मैं policy के बारे में सोचूंगा. That is never bound to happen. So always ask that question, develop that curiosity. The second piece which I have always felt is कि be excellent at what you do. बहुत ही मुश्किल होता है कि when you to plan forward कि in 20 years where I'll be, but बहुत ही easy होता है to be excellent at what you do, what is in your hands and generate an impact. अगर आपने वो impact generate किया तो eventually you will get noticed and you will get the next best opportunity. अगर आप यहाँ पे बोर हो रहे हो और आपने गंदा काम किया तो no one will pick you up for the next interesting thing that you want in life. So I think that is something which I would always encourage. तीसरा, at least in my career I have felt this, lot of planning, lot of information doesn't help. Eventually you have to take a leap of faith. You have to do things despite of all the knowledge, right? कभी-कभी हमारा मन करता है कि I want to do this. Don't ask too many intelligent questions. Just jump into it. There's a very famous speech by Steve Jobs. I'm sure many of you would have heard around connecting the dots. Looking forward, the dots will never connect कि ये चार चीज़ें करके I'll get on to where I want. But historically, the dots always connect. So if you do something with excellence, with passion, with curiosity, eventually the dots connect in ways that you can never imagine. So always have that faith, gather information. It's essential to have that rigor, but eventually have faith, jump into it. Things generally work out. With that, thank you everyone.
Thank you, sir. So, any questions on this? We can take up one question. Okay, then, well, you can keep it with you. We will then take in the end. So, we shall move ahead with the next speaker.
Yeah. Now we would like to welcome Dr. Tulsi Mahadevia to kindly provide comprehensive overview for our audience. Dr. Tulsi is the director at North Star Diagnostic Private Limited, Ahmedabad. She also practices orthodontics in her specialized advanced dental clinic. She is also a trustee at Ahmedabad Dental College. The diagnostic company is the sole authorized diagnostic company selected by the Department of Labour Welfare Board and Board of Roads and Building Construction, Government of Gujarat. She is a young, dynamic entrepreneur, manages the company magnificently, and has been instrumental in taking the company high up the ladder of success in a very short span of time. We welcome you, ma'am.
Good afternoon. It's an absolute pleasure and feel very, very blessed to be here with all of you today. Dr. Deepak sir called me and said that, Tulsi, why don't you speak on this day? And I was wondering, how do I fit? So he told me that, see, you look like a student. So all our students will relate to you. And I think that is the only reason I'm here today, because I look like all of you. Secondly, today I'm going to talk about a little bit my personal journey from how I changed my career path from a clinician to an entrepreneur. What is entrepreneurship? In just one line, I would sum it up as creating everything from absolutely nothing. There was one small incident that changed my life. 3-4 years ago, one of our house help, Devi Singh Bhai, he came up to me and told me कि आप मुझे 2500 रुपये दे दोगे? I want to start my own tea stall. So I said, of course, आप इतने साल से काम कर रहे हो, definitely I would love to support. And after a few months, he took me to his chai ka kitli and I said, Devi Singh Bhai, ये 2500 में इतना नहीं हो सकता है. What did you do? And he told me that मैंने सबसे 2500 मांगे, मैंने 10,000 मांग लिए होते तो कोई नहीं देता. And that is when it clicked that when you want to do something of your own, there is absolutely nothing, whether it is financial constraints, whether it is resources constraint, whether it's your family situation or a social situation, absolutely nothing can stop you when you have the conviction to do something for your own self. Having said that, the statistics on startups is quite sad. As you can see, one of the main reasons is I think everybody agrees, one of the main reasons is that there is so much discrepancy between the valuation and the actual net profit that startups are actually generating. And someone rightly said that as a startup CEO, I slept like a baby. I woke up every 2 hours and cried. And these are the statistics, US statistics, 65% fail in about 10 years. In India, I think it is much worse, these numbers. Having said that, what are the 4 P's and the 4 C's? These are some of the things I remember every single day of my life. My enterprise is only 3 years old, but in 3 years we have seen dizzying heights and dizzying lows. And these are some of the inputs given by my dad, and I never forget these. P, start with, you should know the purpose of your enterprise very clearly, that why are you doing what you are doing. Secondly is the purity of intention. Not even 1%, don't dilute your intention at any cost, no matter how hard it is. Thirdly, of course, perseverance. And fourthly, the positivity. These 4 P's, if you remember, as a founder, as someone who started their own company, I think it's not 99%, 100%, this is going to take you somewhere or the other. You will end up somewhere if you don't dilute it. Secondly, for the team, this all looks very simple, but when you actually get down to motivating your team, clarity of their job, of their role, of how they are contributing in your organization has to be given to them very clearly, why they are here, what they are contributing in. Secondly, their career has to be charted out by you for them. So where will they be in the next 2 years, 5 years, 10 years? They need to see that in front of their eyes. Only then they feel motivated to come to work every day. Thirdly, compensation. In terms of course, money, but even rewards, recognition has to be sorted out for them. And then creating a caring environment for them to grow sustainably. Some of the personal examples that I have sort of overcome is that, as I mentioned, I looked very young. Even when I decided to get into medicine, after my 12th standard, all my friends told me, Tulsi, you don't take MBBS. Nobody will trust you with their life. So then I thought, okay, chalo, let me do dentistry. Maybe they trust me with their teeth. And then I started practicing orthodontics. My mom is also an orthodontist. Even then, moms with teenagers would come, and when they realized I was going to treat their child, they would ask me, are you sure you're qualified to touch my child's mouth? And then my mom would come to the rescue, and then the trust issues were sorted. But now, in our organization, we have more than 150 people trusting me with their careers and their lives. So I'm very, very happy I took this leap of entrepreneurship. What is the purpose of our enterprise? It was a very, very basic purpose with which we started, to maximize human potential. And as a healthcare professional, I knew the easiest way I could contribute in maximizing the human potential around me is making sure that you are healthy and you don't need to go to the hospitals often. And this is the basic purpose by which North Star was born. In fact, within 3 years, we have come up with 4 entities. Ahmedabad Dental College is what we took up just last year. North Star Diagnostics aimed to make sure that you remain healthy for as long as possible. Hydro Labs, which contributes in environmental surveillance, and Ignite Foundation, which we launched just 6 months ago. This, very interestingly, we are getting in the latest and the best technologies for cosmetics and facial aesthetics, because we realize that when you're looking your best, adds a lot of zeal to your life. And that was the aim of Ignite, to making sure you look good externally, you are healthy internally, and you're empowering yourself every single day. Now, all these 4 entities within a short period of time under one roof, is this purely coincidental or is this purposeful? I believe that nothing is coincidence. Every single smallest event in your life is for a purpose. And when you believe this, you will realize that you find purpose every single day. And though these 4 entities are growing individually, together they are contributing a great deal in each other's growth. Coming to North Star, these are some of the glimpses of the center. The main aim of this center is not only just to provide quality pathology, diagnostic, radiology reports, but it is giving the patient, rather the healthy person, an unbiased diagnosis. So what happens is these days even for your annual health checkup, you're already healthy, but you're going to a hospital to get this entire checkup done. Somewhere or the other, the patient feels कि इसको मुझे दाखिल कर देना है. He wants to create problems. I'm already healthy. Why did he advise this and why did he advise that? Here, we don't do any treatments. So you are assured of an absolutely transparent diagnosis. And when they say you need something, because there is nothing that we do in-house in terms of treatment, you definitely need it. So that is the transparency and the vision with which we want to work. Honestly, India has a hospital bed to population ratio of just 0.5 beds per 1,000 people. And the government is working so hard in increasing that ratio. Now, China has up till 4, and that's what we are trying to reach. But that's not the only healthcare goal, right? It should also be that what should we do to make sure that people don't need to end up in hospitals? So that is actually the main thing driving us. That is why we have a little bit different, fresh take on healthcare, that let's prevent what's preventable. And data analytics is playing a major role. In a nutshell, I can say that data analytics can literally literally save lots and lots of lives if done in the correct way. These are some of our reports where if you get tested twice or thrice in the last 3 years, you'll already have a trend as to how your health looks today compared to 3 or 4 years ago. And for all of you, anybody interested in the power of analysis or AI, please feel free to connect with us. Not only this, even in when we go to corporates, we give an interactive dashboard where the head can see how healthy his company is, how healthy his unit is. There are literally incidences where there is a certain leader under whom all the employees are not healthy. So then the HR calls, साहब आप क्या कर रहे हो यार, कोई आपके डिवीजन में ठीक नहीं है, आप कैसे स्ट्रेस दे रहे हो बच्चों को. So this is it's really fun because we know how stress impacts our health, and that is what we are getting into. We have been blessed to be working with some of the largest corporates in the last 2 years. And one of the most fulfilling projects that we are doing now is with the government of Gujarat. We have tested more than 30,000 laborers now in the last 6 months, where these laborers are getting comprehensive preventive health checkup done, which was unheard of. It was only if that they fall sick, they would go to the doctor. Now the concept of preventive care is reaching the grassroots level, and we are very, very happy and feeling very fulfilled to be able to contribute where it matters the most. Coming to Ahmedabad Dental College, we took this up last year, and everybody knows, I think there is a dental student here, everybody knows the sad situation, because half the time the dentists are doing dentistry because they didn't get into MBBS, and then they don't know what they're going to do, what the future looks like. Here we aim to make sure that at least the dental student gets an exposure to opportunity to maximize his potential. So whether it is not just clinical dentistry, of course, the focus is largely on clinical. Along with that, research facilities, product development facilities, pathology, data analytics, academics, of course, the largely growing cosmetic field, the pharmacy field, and we are trying to make sure that our dentists have some alliance with doctors of other branches so that they not only become great dentists, but overall good healthcare professionals. So our aim is to build a comprehensive ecosystem for dentistry as well as dermatology. And lastly, what we are aiming as through hydrolabs, which we are doing environmental surveillance, we developed a state-of-the-art technology for generating early warning signs when it comes to some changes in the environment. We all know, as public health officials, you all know much better, that it definitely impacts our health. And we are trying to develop systems, dashboards, to make sure that we know in real time how these environmental changes are affecting our health. We did this pilot project at Adani Shantigram, which was very well appreciated. We also tracked, in fact, COVID-19 hotspots. And the aim was to get to know 5 days in advance where the next outbreak was going to be. So not only with COVID, we did it with cholera, dengue, chikungunya. We realized that, where are the mosquitoes? In fact, the sample was a sewage sample, but because we do water testing, blood testing, everything in-house, we were able to integrate this whole thing and come up with a closed loop system, which was monitoring air, water, noise, as well as the mosquitoes prevalent in that society. And this actually grabbed the attention of USAID and BCG, and they were very happy to support us in this. I'm really hoping such projects happen more frequently because this was one of a kind, and this is public health in its truest spirit. The 8 key future healthcare trends that we think now is the future is artificial intelligence, personalized healthcare, wearable devices, virtual healthcare, social and public determinants of health, unbundling different aspects of healthcare, medical information, and technology, of course. So anybody interested in any of these areas, please be free to come and chat up. Last and not the least, for every action, there is an equal and opposite reaction, plus a social media overreaction. Today, we have to make sure that we are there on social media, because people like us, we have this responsibility to make sure that the right information goes out in the most interesting way so that people are interested in looking at the right thing. So anybody willing to be creative with whatever knowledge they have, whatever analytics we are doing, and could support us in making sure the right information reaches in a very, very nice, quirky manner, as they say, reels on social media, I think it would be great to work with all of you. So thank you so much. Thank you.
Thank you, madam, for highlighting the challenges and entrepreneurial startups here, but there is a success also which you can visualize here. So any question on this? We can take up only one question if there are any.
Good afternoon, ma'am. Ma'am, I have my own startup and I have my own company, but when we are processing with it, every time, like I'm working from last 3 years, but still we feel like we are on the zero. Every time we feel like we are on zero. There's nothing we have gained, there's nothing we have lost, it's just zero. So I just want to know that how you get it funded, how you have processed it, because I am on the edge of funded, but still there is lack of the things. I feel like, oh no, this is not going to be done, this is not going to be done. So I am just asking that you have gained funds, na?
No, what are you doing?
I have, mine is Women Healthcare Fund, startup.
Okay.
Yeah.
So you are asking about funding?
Yes.
Funding, actually, my North Star is funded by my father. So that is, I mean, we didn't go out to get any sort of funding in terms of North Star. But I would say that in fact was the only negative point we had in our organization. Because initially, the team did not know how to think creatively. Now when we look back, and if I had to do it again, I would never self-fund this thing. Of course, like we can catch up, we can talk about different ideas. But funding, I'm sure, sir.
Okay, so for the funding, first I would like to know that, you said you are working on women health, right? So what exactly in a woman health?
Sir, I have my own intimate wash, which is not a particularly intimate wash, it's an intimate spray because I am from a farmer side. So from there itself, when I was doing research work, we got this an idea and we innovated it.
Okay, so basically it's a device,
Yeah.
right?
It's
a
a
device.
formulation, sir.
Okay, okay. So do you have, what's your product? Mobile app or a device?
No, sir, it's a formulation. It's an intimate spray.
Intimate spray, okay. That's a product.
Yes, yes, yes.
That's a product, spray, right? So physical product, it's a good part. I mean, is it ready? That product is
Yes,
ready?
yes, sir. We have filed for
Fine.
patent also. Everything
So that is
done.
good. So I mean, today only we discussed, Dr. Deepak sir were asking us to visit this incubation center and all. But of course, there are incubation center across India also. Funding, if I talk about Doctor from my side, I also, my father has supported me for this fund. So Doctor is a bootstrap venture, but self-funded things is again a painful company like us for where you are building a platform. So I would suggest that if you have proved that your product is being useful and you have data points, like this many people has already using it, of course funding will not be a much problem. And one thing you can do, your product, strategic partnership, look for the strategic partnership. If your product is adding value to existing different related company in that particular domain who have multiple products, like maybe a pharma, maybe some healthcare products manufacturing companies, that could be a good strategic partnership, I would say, because your product will add value if they are funding to your startup. That's they are adding value, and you will get a benefit of their network of distribution. Both the way, it has to be win-win. Whenever you think about approaching anyone for the funding, think about win-win. Are you adding value to their domain or their expertise and their wealth or so? Then only they will be interested. Otherwise, you will get into this, stress field, because whenever you get a money, you are answerable. So there are moments in Doctor also that we, touch wood, that we have not came in that such situation where you get a funding crisis and all, because I am the second generation entrepreneur. So my father is, of course, supporting me, but ultimately you are answerable for the fund. So go whenever it is required. If you are selling a product, earning enough money to run your show, don't rush for the funding. That's the suggestion I would say. If you are selling monthly 50, 100 your products, you are getting something you are earning, right? And managing your expenses. Take it forward slowly. That will be the part, because you are right now the sole decision maker for your product,
Yes.
right? So, thank you.
Thank you so much. Thank you.
Thank you so much, Dr. Tulsi, for your valuable insights. Last but not the least, we request Ms. Meeta Patel to share her expertise and provide a comprehensive overview for the benefit of our audience. Ms. Meeta Patel is the founder of Medigens. She is a prominent healthcare figure with over 22 years of experience in healthcare quality, patient safety, and administration. She is also known for her expertise in quality assurance, hospital accreditation, and her significant role in shaping healthcare standards through NABH and JCI. As the Joint Secretary of AHPI Committee, Gujarat Chapter, and a former state representative and governing committee member for CAHO in Gujarat, her leadership skills are evident. She also contributes to academia as a visiting faculty at various prestigious institutions. Over to you, ma'am.
All right, so lot of talks from this, and I was just sitting there in front of all these eminent speakers, and I was just thinking, my God, how lucky you guys are. And why are you so lucky? You are lucky because हम लोग जब हमारा career start कर रहे थे, we didn't have any such kind of a platform wherein people, distinguished speakers or distinguished people from all the fraternity of the particular sector that you are actually, studying, they will come and they will guide you for something. We didn't have any such kind of guidance, very frankly, at least not me, when I started my career. So congratulations to all of you. Thank you IIPH for bringing such kind of a platform to the entire, students, all the batches and whatever you are doing currently in your own profiles. I'm Meeta, and I am currently director and founder at Medigens Solutions Private Limited. We are a healthcare consulting firm basically. We will now be 10 years old next year. So we have had a very good experience in terms of shaping healthcare quality, shaping healthcare facility as a structure. So we have various verticals in my company. I'll just give a little brief about my company and then we'll jump to question and answers because I'm sure you're all very tired now. So we are into, one of the verticals is quality and accreditation. We currently have more than 400 to 500 clients, hospital and organizations, healthcare organizations, laboratories, AYUSH hospitals, everybody. They are a part of our, portfolio. We are, second vertical is hospital planning and design, wherein we are currently designing 60 plus hospitals or healthcare organizations, including medical colleges, as a part of our, organization. So we currently have in-house architects, interior designers, consultants, MEP consultants, and everybody in-house with us for this particular portfolio. We have third vertical, we are also into clinical research. Basically, we are a site management organization. So we are aspiring to be one of the largest CROs currently in India in the next 4 years. That is our target. Having said that, these verticals do have a lot of challenges. We have not developed it simultaneously, obviously. We started with quality and accreditation as I was more focused towards that earlier in my career days. When I started my career, quality तो पता ही नहीं था किसी को. हॉस्पिटल में क्वालिटी नाम की चीज़ होती है नहीं सिर्फ हॉस्पिटल तो पेशेंट को ट्रीट ही करना होता है क्वालिटी क्या होती है राइट सो दैट वाज जस्ट अ पार्ट ऑफ something that doctors used to do, nurses used to give injections, that was it. Now eventually when I started into that, I was forced into quality. It was never a first choice for me. I started my career as a marketing person in hospital, So I was a marketing girl. I used to go to corporates, I used to empanel them, and a lot of things happened. And then suddenly एकदम से NABH pop up हुआ country में. I was with Shelby Hospitals that time when I started quality. That was in 2006, 2007. Just NABH अभी शुरू ही हुआ था उस वक्त entire India. So then we started taking decisions about, okay, you have to make policies also, okay, you have to make, अच्छा doctors को ऐसे treat करना होता है patients को, अच्छा nurses ऐसे injection देना होता है. So these all were things that we were gradually learning. So as I said that you currently are blessed with all these things, you already have that little bit of knowledge with you, so you can now just enhance upon it. You don't have to reinvent what is already been done. So my advice to you is going to be that कि जब आप career अभी already आप लोग सोच रहे हो कि हमें क्या करना है, most of you are confused, I'm sure. वी ऑल मोस्ट ऑफ अस आर नॉट अवेयर कि इस स्टेज पे मुझे कौन सा डिपार्टमेंट लेना चाहिए, व्हाट शुड आई डू, शुड आई बी अ CEO ऑफ द हॉस्पिटल और शुड आई जस्ट फोकस ऑन वन पर्टिकुलर डिपार्टमेंट ऑफ द हॉस्पिटल, और हेल्थ केयर बैकग्राउंड पब्लिक हेल्थ में हो तो कहाँ कौन सी फील्ड में मुझे जाना है. सो बी ओपन टू ऑल द लर्निंग्स, एवरीथिंग ज्ञान सब लोगों ने दे दिया है. आई एम जस्ट telling you to focus on that. You are lucky enough to listen to all of us and just make sure that when you're noting this down, आधी चीज़ें तो आप भूल जाओगे आज, आधी चीज़ें 70% ऑफ इट कल भूल जाओगे, उसके बाद तो आपको याद भी नहीं रहेगा कि हम लोग कोई आए थे एंड ऑल दैट स्टफ, राइट. सो वेरी फ्रेंकली इट इज़ गोइंग टू बी अ रीइटरेशन. आपको जहाँ पे भी लर्निंग मिले, any platform that you are you being a part of, just make sure that you start learning. Right? Learning not only about your own field, learn about anything that comes to you, because I think somebody asked about how to improve communication with each other. So how can you improve communication? Only when you know something, you are going to speak something to somebody. Communication is always both ways. It's not just one way. Right? So when somebody receives your, when you say some words, somebody receives it and somebody understands it, that's going to be a complete communication loop. So when you communicate, make sure that you know what you're talking about. You should know what actually, the fact of those particular topic and everything. Secondly, you make sure that your attitude is correct at this stage. When I started my career, मुझे मेरे जो mentors थे उस वक्त, मतलब my boss, basically that was the only thing that we had as a mentor. They said never say no. Never say no to anything that is given to you in that particular job. मुझे मार्केटिंग करना था, लेकिन मुझे साथ में क्वालिटी, मैंने बोला मुझे फोर्स किया गया था क्वालिटी में, बट देन ग्रेजुअली व्हेन आई एंटर्ड इनटू क्वालिटी आई थॉट ओके दिस इज़ व्हाट आई शुड डू, बिकॉज दैट हैड सम पर्पस. मार्केटिंग में क्या है, हॉस्पिटल में आप लोगों को बिजनेस लाना है. क्वालिटी में यू आर एक्चुअली गोइंग टू इम्प्रूव द एंटायर प्रोसेस ऑफ द सिस्टम ऑफ द एंटायर हॉस्पिटल और द ऑर्गेनाइजेशन यू आर वर्किंग इट, राइट. सो ग्रेजुअली यू विल गेट टू नो आपको क्या करना है. हो सकता है आपको मार्केटिंग में इंटरेस्ट हो सकता है यू वॉन्ट टू डू दैट, हो सकता है आपको HR में इंटरेस्ट हो, यू मे वॉन्ट टू परस्यू दैट, बट initially please make sure that you have an experience of each and every department you're working in, each and every thing. So as an intern, when if you're going to start your internship, make sure that you have the opportunity to go to each and every department and learn what they are doing. Only then you will get a clear knowledge कि वहाँ पे exactly क्या हो रहा है. So बुकिया ज्ञान सबके पास है, you know what is operations, you know what is marketing, you know what is finance, but when you actually enter into that, it is a completely different ball game, I tell you. You are not going to learn, you're not going to implement whatever you have learned today. So make sure that you have an experience of each and everything. Secondly, as everybody said, keep on learning, because that is only going to help you in, अभी यहाँ पे ख़त्म नहीं होता, आपका journey begins now. I'm sure everybody knows that. It is now, the entire journey is a learning. So अगर कोई course है आपके related, तो make sure that you enhance that thing. Enhance your skill, because every day आज जो आपने सीखा है वो कल obsolete होने वाला है. So it is going to upgrade. WHO is upgrading its guidelines every 1 or 2 years. Every 6 months something else is coming. AI is coming in full swing. So AI is going to get integrated in all your business models or everything, whatever you are doing. So even if you're a startup, even if you have a public health job, even if you're going for a corporate hospital person, make sure that you are completely into that growing stage. Only then you will be able to grow. So having said that, I would not take much of your time, but just be clear on what you want to pursue only after you have experience of each and everything, right? एकदम से आप, मैं जब छोटी थी जब मुझे डॉक्टर बनना था बनना सबको सब कुछ है, but you are sure you're not going to be what you want to become. It's only you are going to be when you going to experience certain things, and then you have to say. So you can be I didn't know I would become an entrepreneur after, I mean, I had an extensive job experience of around 16 years. And after that, I started my own firm. So you have to, you never know what life will bring. So just embrace whatever you have, whatever you're going to have, and just enjoy the journey of life. Third last thing I would like to say, don't let your personal problems interfere your career stage right now. It is very important. Why? Because अभी आप लोग जो एज में हो, either शादी की बात चल रही होगी, या घर में कुछ ऐसी प्रॉब्लम्स चल रही होगी, या कुछ ना कुछ ऐसा हो रहा होगा, because wherein our mind is going to be occupied, right? So when your fiancés or when your spouses are, they will have their own expectations from you. शाम को घर जल्दी घर आना है, तुम तो हमेशा जॉब में पड़े रहते हो, तुमको कुछ काम की घर का कुछ ख्याल नहीं है, ये सारी चीज़ें आपको कॉन्स्टेंटली आएंगी. दीज आर ऑल स्टेजेस ऑफ द लाइफ वेर यू हैव टू पास थ्रू. सो मेक श्योर दैट वो चीज़ों को आपको साइड में नहीं रखना है. यू हैव टू, ऑब्वियसली दैट इज़ प्रायोरिटी 1, प्रायोरिटी 2 इज़ योर करियर. सो यू हैव टू बैलेंस दैट. एंड हाउ कैन यू बैलेंस? सर ने बोला था बीच में मेडिटेशन. So he was right on spot. You start meditating and your minds are going to be, your thought is going to be clear. Your attitude towards the job and your family is going to be very clear. Third thing is that you have to make sure that your, never say no wala attitude is there currently. And when you gradually build your career, 40 years, 50 years के आप हो जाओगे, उसके बाद start saying no to certain things. So there are two aspects always. पहले never say no आएगा, उसके बाद start saying no आएगा. तो अभी से start saying no पे मत जाओ. Otherwise, you will not learn anything and you will end up, I don't know where, right? So these are all things that, very small things, but you have to build up accordingly. So all the best to you guys. I'm just winding up a little early. Anything, if you want to ask, please let us. The stage is, I think, now open for all. Thank you.
Thank you, madam. If there are any questions, and after this, only one more question, and then we'll wind up. So,
hi everyone. I'm a first year MHA. I wanted to ask for an health. We know that as we've joined, we know that there are opportunities outside the hospital. So, in a healthcare administrator perspective, what are the job opportunities available in all the foundations, and like what would be a suitable roadmap to take? Like if you want certain skills from our side, what would be the good skills that we would have to acquire, or certification programs or any such things, are they required? And if yes, which all? Thank you.
yeah, anyone would like to respond to this?
Okay, I'm not really sure if I got your question straight, but if my understanding is correct, what you're actually asking me is that you want to be working outside of the hospital setup, is it? You don't want to be a clinician in the clinic?
No, although I'm a hospital MHA, a Master of Hospital Administration, but we've been told that right now the healthcare industry is expanding and there are opportunities outside the hospital, like consultancies or insurance or...
Okay, great. See, there are multitudes of opportunities outside of the traditional career path that a lot of us follow. And that has always been there. Yeah? If you look at this particular stage that you're actually addressing right now, you can see entrepreneurs who have actually scaled up operations in the field that you're actually studying without any background in that. Somebody like me landed up in this sector, yeah, by design or by choice. After spending, like Meeta ma'am also said, 15, 16 years in multitudes of industries, and she never imagined that she would have been an entrepreneur. Same is the story with me. 16, 17 years working all across the globe. I never imagined I would have to go out into the market and ask funds for my startup, raise funds for my startup. And once I had successfully started a startup, I never in my wildest dreams imagined that Bill and Melinda Gates Foundation would headhunt me to sort of get into the social sector, because it was never there. So to answer your question straight, I think you're constraining yourself. I mean, forgive me for being so blunt. You're constraining yourself by the simple fact that you're अभी से सोच रहे हो कि मुझे क्या-क्या सर्टिफिकेशन करना है, मुझे क्या-क्या काम करना है, क्या काम करके मैं किस तरह से आगे बढ़ूंगी. So, I mean, it's a consensus among everybody on the bench here that at least explore what is available outside. अभी आपने मुझे straight सवाल पूछा कि क्या-क्या है. The sky is the limit. ऐसी बहुत सारी चीजें जो हम में से किसी को पता भी नहीं होगी. जैसे मुझे आज पता चला कुछ चीजें सुनने के बाद कि ऐसा भी हो रहा है. So please explore. And again, it's a platform that you people have that you can actually engage with a lot of participants and engage with an alumni network that will help you grow. As I said, at your age, I was selling SIM cards in Ahmedabad. वो भी prepaid. ठीक है? So explore. अभी से ये you're putting on blinkers. That मैंने ये certification पे concentrate करना है. No harm in doing that if you are very clear कि मेरे को ये ही करना है. सचिन तेंदुलकर को पता था मैंने क्रिकेट ही खेलना है. उसने जिंदगी में और कुछ नहीं किया. ऐसा कुछ है तो करो, no doubt. लेकिन my humble advice is, please ensure that you're explored enough before tying up your career path and putting on those blinkers. After that, single-minded determination will help you.
Sir, I'd like to clarify. I meant like in the beginning, everybody was focusing a little bit of public health perspective. So I wanted to clarify for my batch as a hospital administrator. Is there an opportunity for us also? So
Yes.
that was my question.
Okay. Okay. I think what I'll suggest in your question, there are 19 sectors in healthcare industry. If you consider pharmaceutical, digital health, healthcare IT, or healthcare consultancy, hospital, diagnostics, etc., you will that is 19 healthcare sectors. So these are the sectors is your field. What I'll just like to add upon that as you ask about that what all are different certifications we can do it. Being an MBBS background, I always, whenever I started, I did MBA healthcare management. So whenever I started, I never think about other than hospital. That was, one of the guided missile landed upon on me. Obviously, even I have seen many students carrying a background of homeopathy and Ayurveda, they land up in the hospital only. So I also land up initially in a hospital administration. While working as an administrator, I used to attend few conferences and workshops. So at that time in 2013, there were very few hospital administration or healthcare management related events happening in Gujarat and all. So I used to travel in, I remember I attended a few in Delhi, one in Bangalore and Chennai. The subjects were healthcare marketing, healthcare business development, and one I remember in 2013, I attended digital marketing seminar. And just to, giving a context, while working as a hospital administrator, earning 30 to 35,000 per month, attending such seminar, it's a cost adding to you. But still, as a part of curiosity, I don't know what is digital marketing in 2013, but I attended in Ahmedabad, it was happening. And that news, I got it from the newspaper. I spent 5,000 rupees traveling, etc., whatever this is, but there was 2-day workshop. And I did it. I never used it for 5 years or so. But when I started DocHub journey, I realized, and that sir has rightly said, the history connects the dots. And I landed into the health tech and digital world, where I used to interact with digital guys, tech guys, how they think. At least I can now say that if I have attended that workshop, I know something about digital and digital marketing and something related to website and all. Otherwise, I was blank, and even I could have not taken this decision to go to the health tech also. So I would say that opens a window of digital world, that one seminar, wherein no one was from the healthcare or medical background. Everybody was from a tech background or any non-healthcare background. So yeah, that could be the identifying. You will get what skills certification you will done while attending such kind of things. So that is my take on this. Thanks.
As we move towards the end of our career talk, I would like to thank each one of you for adding immense value for our gathering. And let's have a big round of applause for all our experts today. I would like to extend our heartfelt gratitude to our esteemed guests for gracing us with their presence and sharing their wealth of knowledge during today's career talk. Your insights have illuminated our path and provided invaluable guidance as we navigate the complexities of our professional journeys. We are truly fortunate to have had the opportunity to learn from experts as accomplished and as inspiring as you. Thank you for investing your time and expertise in shaping our understanding of the professional landscape. So here's to the wisdom gained and path yet to be explored. Thank you, everyone. Now I request all the people on the dais to come forward for the group photo. Sorry, there's a... we'll go for the felicitation first.
It's time for felicitation. Our eminent speakers are invited. We request Dr. Anees Sinha to felicitate Dr. Saurabh Parmar. We request Dr. Anees Sinha to felicitate Dr. Anup Nair. Sir, please felicitate Dr. Akash Shinde. Next, we felicitate Dr. Sandeep Patel. We request Sir to felicitate Dr. Dilip Parmar. Sir, please felicitate Dr. Purav Gandhi. We request Sir to felicitate Dr. Tulsi Mahadevia. Sir, please felicitate Ms. Meeta Patel. Now, we request Mr. Vijay Panchdhane to felicitate Dr. Anees Sinha. Thank you so much, sir.
Now I request all the people on the dais to come forward for the group photo.
Just one thing, since we could not take up some questions from you, I request we all will be there for the lunch after your valedictory. So you can definitely interact with our esteemed panelists, and even if something remains, you can contact us. We will try to connect you with them. So thank you very much. Thank you all.
All right, moving to our last and most awaited segment for today. Let's start the prize distribution ceremony.
First, we would like to announce the results for student-led cultural activities. Okay.
I request all the faculty members to come forward and have their seats. Yeah, so let's start the prize distribution ceremony. We have Tapaswi sir on the stage. And yeah. Now let's welcome Dr. Deepak Saxena sir on the stage, Director, Indian Institute of Public Health, Gandhinagar. Now let's welcome Dr. Anish Sinha sir, Registrar, Indian Institute of Public Health, Gandhinagar. We welcome you, sir.
Now let's start with the prize distribution. First, we would like to announce the results for student-led cultural activities. We would like to invite Dr. Apurva to present the award for face painting. The second runner-up for face painting is Vishwa from IIPHG. The first runner-up for face painting is Mudita from IIPHG. Dr. Apurva, please present the award. We request Sir to present the award to the winner of face painting, Anjana from IIPHG.
Congratulations, everyone. So, moving to the next segment, solo singing. I request Dr. Medha Vadwa to present the award to the winners. So, the second runner-up for solo singing, Dr. Petrus B., Parul University. Congratulations, Petrus. The first runner-up is Mudita from IIPHG. Moving to the winner of solo singing. Any guesses, guys? Yeah, the guess is correct. Shruti Krishnan from IIPHG. Shruti, would you like to sing something? Yeah, that would be great. Please.
A very good morning to one and all. आपकी नजरों ने समझा प्यार के काबिल मुझे दिल की धड़कन ठहर जा मिल गई मंजिल मुझे आपकी नजरों ने समझा.
Well, that was a treat to our ears, Shruti. Thank you.
Now, we would like to announce the results for solo dance. We would like to welcome Dr. Shalu to present the award to the winners. Our second runner-up for the solo dance is Renu Yadav from IIPHG. Our first runner-up is Henna from IIPHG. Now, the winner for solo dance is Vanshika Yadav from IIPHG.
Well, the crowd says it all. Very well deserved, Vanshika. Congratulations. Thank you, ma'am. I would like to request Dr. Arundhati Thackeray, Parul University, to present the awards to the winners of group dance. The second runner-up for group dance is Group 1, Shairi, Khushi, Akshay, Mansi, Surekha, and Swachania. Everyone please get on the stage, please. Congratulations, everyone. The first runner-up is Group 4, Ankit, Anandu, Ashwin, Vanshika, Swati, Anjada, and Harleen. Congratulations, guys. Guys, come fast, please. Congratulations, team. Now moving to the winner for group dance. Any guesses, guys? Every time you're being correct with the guesses. How? Well, yeah, the group dance winners is Group 3, Jyoti, Yamini, Komal, Dishani, Lakshmi.
A huge round of applause for these students. Now, we would like to announce the results for research activities held in ACIES. We would like to call upon stage Dr. Dhaval to present the award for poster presentation. Our second runner-up for poster presentation for the title Health System Strengthening is Himani Vyas from Dharm Singh Desai University. Our first runner-up is Richa, Aarti and Ragini for the title Waist-Hip Ratio, an alarming sign for hypertension burden. The winner for poster presentation is Pratham Sharma from Parul University for the title The Effect of Consumption of Bite-Sized Content on Cognitive Capacity of Adolescents and Their Academic Outcomes.
Moving to the next activity, I would like to call Dr. Jay on the stage to present the award to the winners. Yeah. The second runner-up for research proposal, Dr. Sankalp and Ashlesha Mishra, IIPHG, for effect of wheatgrass juice versus iron supplement on hemoglobin levels in anemic adolescent females aged 15 to 19 years in Aravali district of Gujarat, a 12-month intervention study. Congratulations, guys. Next, we have first runner-up, Richa Gwalani and Aarti Yadav, Dr. Ragini Shah, IIPHG, for prevalence of bovine tuberculosis in cattle and associated risk factors in human from western state of India, a cross-sectional study. Moving towards a winner for research proposal, Dr. Pranal P. Shah, Parul University, for a study on assessment of home-based care for newborns and young children by ACIES in Vadodara district. Do we have him here? Yeah. Any faculty or anybody from Parul University can receive the award.
Now, we will like to call upon stage Dr. Anurag to present the award for Ideathon. Our second runner-up for Ideathon, for Ideathon is Dr. Amit Kumar and Dr. Anvita from IIT Delhi for the title Street Installed Solar Operated Device for Dengue Surveillance and Control. They are not here. Thank you. Our first runner-up are Prathamesh Gadge, Rohit Kaware and Rajat Panchbudhe for the title Healthcare App for Chronic Disease Management. The winners for Ideathon are Dr. Umang Yadav, Dr. Mehak Soni and Apeksha Mathur from IIPHG for the title Mental Health AI Bot MindMate. Now, we would also like to announce the results for student competitions organized on the eve of One Health Day. We would like to invite Dr. Yashoban to present the award. For poster making, the winners are Dr. VL from IIPHG. For One Health photography, the winner is Mr. Kaushik Pal from IIPHG. Now we would like to announce the results for a quiz organized by Parul University. We would like to call upon stage Dr. Krupali from Parul University to present the awards. The winners for quiz are Lalita, Priyanka and Mansi from IIPHG for MPH. For MHA quiz, the winners are Shivangi, Shrushti and Rashmi from Parul University. Now, we would like to announce the results for marathon.
I would like to request Dr. Anish Sinha sir to come forward and present the awards to the winners. Marathon, male category. The first runner-up is Dr. Petrus B., Parul University. Congratulations, Petrus. The winner for marathon male category is Bilal Hassan, IIPHG. Congratulations. Now moving to the female category marathon winners. The first runner-up is Jyoti Singh from IIPHG. Congratulations, Jyoti. And the winner for marathon is Harleen Kaur from IIPHG. I'm handing over to Richa ma'am for the valedictory.
Good afternoon to distinguished dignitaries, participants, and all my colleagues present over here. As we conclude this enlightening 3-day annual conclave, I stand before you with immense gratitude and fulfillment. On the behalf of Indian Institute of Public Health, Gandhinagar, I extend my heartfelt thanks to each one of you for your active participation and invaluable contribution to making this event a resounding success. First and foremost, our sincere appreciation goes to our esteemed speakers and panelists who generously shared their knowledge, expertise, and insights. Your presentations have illuminated the complexities and advancement in the field of public health and hospital administration, inspiring us to explore innovative solutions for the challenges ahead. At this juncture, I want to extend my heartfelt gratitude to our director, esteemed faculty members, and admin team, without whom this event would not have been possible. I would also like to express my gratitude to the sponsors whose unwavering support made this conclave possible. Our sincere appreciation also goes to the dedicated organizing committee members, student committees, all the research colleagues, and other team members who worked tirelessly behind the scenes to ensure the seamless execution of this conclave. Your hard work and dedication have truly made a difference. Last but not the least, I extend gratitude to all the students, management staff, technical support teams, and all those who have contributed in various capacities to make this event a memorable experience. As we part ways, let us carry forward the knowledge gained, the connections made, and the enthusiasm sparked during these 3 days. May the insights gained here fuel our collective effort toward achieving a better public health outcomes for our communities and beyond. Thank you once again for your participation. And now, I would like to invite everyone to join us for the group picture. Thank you. And after the group photo, we'll join for the lunch.
सर वो डायरेक्शन में लेना था, इतना क्राउड नहीं आया था, नॉट पॉसिबल। हाँ
Hello. We request the organizing committee of ACIES to stay back for the photos.
चलो वहाँ पे जाते क्लास वाले चलो